Good evening, everyone. Thank you for attending tonight's special meeting of Board of Education for the Oak Creek Franklin School District. I'd like to call the meeting to order. Please stand for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, Jill.
Frank Carini.
Here.
Cheryl Cerniglia.
Here.
Leah Schreiber-Johnson. Amy Malat.
Here.
Mark Verhalen. Darren Gabowski.
Here.
Jane Eichhoff.
Here.
All right, thank you. Number 4 on the agenda is a public input. We'd like to recess former portion of the meeting to entertain comments or questions on the agenda item. We do have this lovely gold sheet, and all the information and rules and procedures are on top. And if you're interested, it is limited to 30 minutes. Each speaker has 3 minutes. I will remind each speaker that there is a minute left so they can sum up and so they can everything they want to say to the rest of the board. I do have one right here, but didn't check off. So I'm going to turn it to Chris and see if there's anybody in the room that wants to speak to the board.
I'll also note for the record that the board has received public comment through the website. Significant amount. They've been provided with those comments that people made and sent to us preceding this meeting. And I see Mr. Technology is ready over at the 9th grade center. So if we wanted to start over there, it seems like they're all ready to go. If that's okay with you, Mr. Carini?
That'd be great. Thank you.
Okay, so Mr. Technology, we'll keep an eye on the clock here and we can start working through.
All right, you are live.
Thank you for allowing us to speak tonight. My name is Ellen Moon. For months, we've been faced with COVID-19. We have all have our own stories how this affected our families and our students. My high school students are outstanding students and have come to me multiple times during school shutdown, and they said, I never will say I don't want to go to school again. When I asked them why, their responses have been, I feel like I'm teaching myself. We have videos to watch, but it's not helpful. And I miss in-person instruction. Of course, they miss being with friends, clubs, band, and other activities. Many, if not most of you know, my son Kyle has Down syndrome and receives special education services, which includes academic, speech, OT, PT services. Not only are typical students suffered during this time of school being closed, but take a moment to think about it. 20% of services were only required to be delivered to our students with special needs. 20%. Regression is typical over summer months, but it's getting to the point of serious worry for myself and other parents I've spoken with. A special education student also missed out on being part of the general education setting. Like other families, this has been a stressful time. As we watch things open up, it still makes me a little crazy to see beer gardens open, happening in parks, farmer markets open, volleyball teams playing, some sports being played, while others are canceled, and now school could possibly go virtual again. I was relieved when Oak Creek released a draft plan a few weeks ago, in person or virtual. This seemed to be a good plan. If you felt strongly for in person, you could attend safely, and if you felt virtual was best, you could choose virtual. I just told you a few reasons why my kids want to be in school. Please don't mistake my choice to mean I am not fearful of my children, other children, or our staff becoming ill with COVID-19. I pray hard daily. The precautions my family has been following are the same precautions the school and other families are taking as well. What I am most worried about is we will not have a safe time to open. My vote is to go back to school in person and teach common sense hygiene at home and in school. I could stand here for a long time and tell you many thoughts and opinions. Please consider all students, especially our students with special needs, before making your decision. Those that want to go to school face-to-face should have that chance. Those that want to stay home.
Ellen, you have 30 seconds.
Let them do that. If the vote is going to be complete virtual, please consider letting special ed students attend school by appointment with their special ed teachers for academics, speech, and other services that need to be provided for each student's IEP. Thank you.
Thank you.
Over here.
Is there another one?
Mr. Helm, do you have any more people over there to speak?
Yes, I have them queued up outside of the speaking room.
Thank you.
Go ahead. I want to thank you guys for the opportunity to speak and share our experience as an Oak Creek family of how our kids are completely different. We have two kids that are in high school. One's going to be a senior, one's a sophomore, and they're two different people, two different kids, and they learn differently. And I just want to stress that a one-size-fits-all solution is not what it's all about. You trust us. We know our kids. Let us decide what's best. If we want our kids to learn in person, you need to give us that option. My daughter does fine, self-starter, a go-getter, knows what she wants, has no issues learning online, learning virtually. My senior, a little more difficult. He became depressed. The mental health aspect of this, let's not forget that. He's a happy-go-lucky kid, well-liked, captain of the wrestling team, captain of the soccer team. You could see the depression set in late March, April, May, and June, up until July when they were allowed to go back and train with their teammates, whether it be soccer or on the wrestling mat. He struggled learning virtually. Thankfully, Mrs. Huber reached out and helped guide him to a successful end of the semester. I think you have to take into consideration each student individually, and I thought you guys did a wonderful job with the surveys, letting us decide what's best, because we do know our children best. I don't envy you guys right now. I used to think you guys had a cushy job. I don't envy you guys making this decision. I would not want to be in your shoes, because unfortunately, 50% of the population of Oak Creek is going to hate you for it. 50% are going to love you for it. But I do think that
1 minute. 1 minute left. You have one.
I think it's best to let the parents decide and give them the option to either learn virtually or in person. I thank you guys, and I appreciate your time and everything you guys are going through.
Thank you.
We can go around TVs. Whenever you're ready. Straight up. Good evening. My name is Steve Prendergast. I have 3 children in the school district. In preparation for the meeting, I did a lot of research, pulled facts, looking at the CDC, the American Academy of Pediatrics, etc. However, it occurred to me that my motivation is not to convince anyone of the dangers of, or the lack thereof, COVID-19 to their children. What motivated me was finding out that there is a group within Oak Creek that wishes to remove the option that has been presented to families already to decide. So my question to you is to please maintain the option to either attend virtual or to attend in person, and let each family make that decision. Thank you.
Thank you.
Good evening. My name is Jennifer Latus, and I have a 5-year-old that is slated to go to kindergarten this year. On July 20th, we received an email from the school district that communication is important and that we would receive weekly updates. You called us, you sent us reminders to complete the survey, which we did, and then we heard nothing for 2 weeks. The communication did break down when this meeting happened. The community was not notified unless you specifically went to the school board district website, which I feel is a complete lack of communication to the parents of students. 35 cents of every one of our tax dollars go to the school district, and yet my child may never step foot in a school this year. 68% of parents in a recent nationwide survey support that in-person learning is best for kids and what they prefer. I am included in that 68% with a child that is supposed to start 5K in approximately 3 weeks. The school district did make a decision to offer a choice to parents. You can go in person or you can go virtual. This leads me to believe that this is mounting pressure from teachers and teachers unions. And what I have to say back to that is that they do not necessarily know what is best for my child. I am the parent. I know what is for my child. I wake up every day and have to go to work, as does my husband go to his office every single day. I can take my kids out and about when I don't have adequate childcare, to the grocery store, to Target, to Walmart, but I may not be able to send them to in-person learning at school. The teachers have a job to do. If they opt out, maybe they should relinquish their salary and give it back to the hard tax-paying citizens of Oak Creek and Franklin. What are parents that work full-time supposed to do? Send kids to daycare? And why is it that daycare is so willing to accept our children? Why is it that the YMCA is offering programs to help students learn, but our own schools are not? If we shut down the schools for every case of lice or strep throat or pink eye, they would never be open. And while there is a lot to still learn about COVID-19, we do understand that, but we cannot continue to disappoint our children and not provide what is actually best for them.
Jennifer, you have 1 minute.
We are failing our children. And I strongly encourage you to still make it an option for the parents to decide what is best for the children. Thank you.
Thank you.
Straight ahead, you got 3 minutes.
Am I on?
Yep.
Doesn't show me. All right. I'd like to thank the board for offering this opportunity to speak. I have been paying attention to the school board's plans for reopening for the past several weeks with frankly growing alarm. When I compare Oak Creek's plans with the surrounding communities, I find myself wondering, why is it that we feel that we can jump in with both feet and send all of the students back into the schools when every other community in our immediate vicinity has decided otherwise? Even like, especially for the high school and middle school kids who research has shown are every bit as able to catch and pass on COVID-19 as adults. I feel like we're setting ourselves up for a logistical nightmare as far as being able to manage people being out, quarantines, schools, having to deal with multiple cases at once. It just feels like the plan was not fully thought out. Like, I mean, the state guidelines that have been provided show numerous different hybrid formats that allow kind of phased and slow reopening, where portions of the student body are present in schools so that you can work out the processes and your means of mitigating infection and controlling the student body to minimize infection spread. But we didn't do any of that. I mean, even Cudahy's got a hybrid plan for their high school. I find it kind of embarrassing as a citizen of this community that we didn't come up with anything better. This is basically the way we always reopen school, except now everybody's wearing masks, and they weren't going to be required to wear masks. We were going to open the schools up with them being optional.
Sir, you have 1 minute.
I have no confidence. I would like to see some more concrete details about what we actually are planning to do. Everything on the website is, well, we'll consult and play it by ear, and that just, based on what I've seen so far, doesn't fill me with a warm, fuzzy feeling. And we're also supposed to decide whether we're going virtual or in person before any of this is concretely laid out. It seems unfair. That's my position. Thank you for your time.
Thank you.
Here. Yep. I'm start. Wonderful. Good evening. Thank you for giving me the opportunity to speak. Honored members of the board. I would like to share a brief story in terms of my background. I'm a child of 2 teachers from back home in Germany, a country that similarly struggles to grab hold of the COVID-19 pandemic. I've seen a variety of plans that have been proposed, and I acknowledge that coming to a consensus and to accommodate all needs in our community, all perspectives, all viewpoints on whether or whether not this pandemic is as serious as it sounds, and for some who believe that it is made out to be. It is a tough task and it's a tall order. What I would like to express, however, is my criticism of what feels like plans that have been put in place that continue to further a divide rather than bringing our community together. I would like to emphasize a message of empathy for all of our members in our community who have very different challenges, very different needs. We have single parents who are not able to leave their children home for virtual schooling. They're overtaxed as it is. We have members of our communities losing their jobs. We have members of our community, my wife included, as essential workers who are working in healthcare facilities, hospitals, and laboratories across the nation and across our city. I would like to urge you to consider to come up with a plan that takes these viewpoints into consideration and that it accommodates the needs in one holistic plan rather than making parents choose to be taught by Oak Creek staff, Oak Creek teachers in the respective schools, or having to choose to go to a third-party provider that most folks don't know much of anything about. So in terms of information sharing, I would have appreciated more of an update and frankly, more ingenuity and innovation from the board to come up with a plan that might allow children to return to school who have essential workers as parents, who have parents that are single, who have extraneous circumstances to not accept or accommodate a virtual teaching option. Those children could very well go. Yeah. The Fine TV that I'm speaking into, for example, is in pretty much every classroom in Edgewood Elementary School that I've seen. Why would it not have been possible to think of a model where we have a hybrid instruction where the children that need to come to the classroom are present and the ones that choose to go home are being taught by the exact same teacher that they otherwise would have had in that same grade with their same peers in the same class? I don't understand why that was so complicated to think up and putting parents under pressure to make a choice by tonight. So far, to the best of my knowledge, the deadline has not been extended, to make a choice between going to a third-party vendor that we don't know or go with the teachers in the Oak Creek Franklin School District that we all appreciate and love. I would like you to do better. Thank you.
Thank you.
My name is Sarah Atkinson. I've got 2 kids in Oak Creek. I'm also a public school teacher. I just first of all want to say I applaud our administrators and teachers who have been working very hard during these unprecedented times. I'm asking us to stand firm and to not give into a fear mentality that we shut down and rob these kids of education in person with their peers in their classroom and their teachers because of fear, because what we're doing is we don't know if a kid is going to get COVID, but I can guarantee pretty much that if we take them out of the classroom, there's going to be depression, there's going to be special needs kids that don't get the attention that they need. As a teacher, I'm a mandated reporter. If I see child abuse signs going on, I have eyes on that. We owe it to our kids to give them that opportunity. And parents, I understand if you have concerns. Nobody's making you put your child in a classroom. You have that option. And I completely trust the administration to have a backup plan should everything erupt, that we can be ready and adjust as we need to. There is an article in the CDC that you can look up yourself. It says the importance of reopening schools, and it says that it's harmful, more harmful, to keep them at home. The CDC is urging to send them. Kids are not getting as sick as you thought they were. And the social, emotional, and behavioral health and economic well-being and the academic achievement, our kids are going to be brought, they're going to fall behind despite our best efforts. So I'm asking us to be kind. I'm asking us to work together. I'm asking us to stand firm and not give in to the politics and the fear that is crippling our society everywhere. We are so divided. We are so divided.
You have 1 minute.
Now is the time to come together, to work together, to support each other. But just because you don't want to send your kids to school, I have the right to send mine. And Oak Creek has an amazing reputation in the state of Wisconsin, amazing educators, and I'm so proud to be a part of that. And I'm asking that you don't reduce it. COVID's not going away this year that I know of. It might be here 5 years from now. How long are we going to shut down our schools? How long are we going to keep our kids at home and deprive them of the education? We're going to reduce our reputation.
Sarah, you have to wrap. You got 5 seconds.
Thank you.
Yep. Thank you.
Yeah.
20 minutes.
Whenever you're ready. Okay. My name is Scott McGee. I'm a resident of Oak Creek. My son is going into first grade at Shepherd Hills. And I remember when I was thinking about what I was going to say, the only thing I could think of was how he struggled at the end of 5K last year. And I think the only thing that really got my wife and I through this and getting him through doing all this homework was telling him that he was going to be able to attend first grade class with his teacher, which, you know, I've seen a regression in him from where he was virtual learning last year to where he is now. My wife and I both work full-time during the day, and it was a struggle to get him to do assignments. I think, you know, a child who's in elementary school, telling them to sit in front of a laptop and do assignments, I think it's, you know, really asking something that they just don't have the capacity to do. And to have someone like that, you know, struggle, and to see that struggle and see how he doesn't want to do that assignment and then have to fight with him at night to try to get those completed after events and other things that he's got going on during the day. That was something that we told him, hey, we've done this survey. You're going to be able to go to school. You're going to be able to see your favorite teacher. You're going to be able to see your friends. And to have that potentially taken away 2 weeks before school's supposed to start without giving us an option or the time to try to find an alternative to him, whether that's a private school or some other type of virtual learning that we know he'd be successful in, I think is doing him as well as some of the other elementary school students a great disservice. And I think some of the other people hit on this, but I think when you look at, you know, the other challenges that kids are facing, whether it's, you know, kids going hungry because they don't have access to the school meal programs or students that are being abused, I think there's a lot of things that can do harm to our kids. And I think COVID on the list of those things is very minor compared to the abuse that some of those kids can take, the hunger that they're going through. And if we're going to give it to fear and say, we're going to start virtually, to me, that's a slippery slope where it starts virtually and there's never an opportunity to say, now we can go back full time. And now all of a sudden it's gone from you can do virtual for the first quarter to now, you know what, it's just not the right time to go back in person. And that's just going to be something that's going to continue to happen throughout the year, as I think it's going to be a lot of pressure on, you know, other organizations saying, you know what, now's not the right time. The statistics just aren't there. And from my perspective, COVID, as other people have mentioned, is not going away. And if we're going to look at that and say, you know what, we just have to wait till the time is right, well, the time could never be right. And my son could go through all of elementary school. He could be behind because of, you know, the lack of action on the part of the school board. And if that's something that he's going to have to face, and I'm going to have to, you know, look at him every day, you know, with sadness, get despondent because he's stuck trying to learn on a laptop and he doesn't know how to use it. And we can't work with him until we get done with work at 6 o'clock at night and try to do assignments with him at, you know, for 2 hours at night. That's just not going to work. And I think it's not going to work for a lot of parents. And I think you need to really consider those factors when you make a decision.
You know, I do stuff back here. I know, but far enough away.
Yeah, right there.
Let's make sure am I up here too? Okay, hi, my name is Britt. I just want to speak to my in favor of face-to-face learning. Thank you for allowing us to speak and for all your work being done, school board. I want to speak to, I have an advanced learner at home, and I know that in the virtual setting, advanced learners aren't taught beyond their grade standards. Advanced learners require in-person learning just as those with special needs require it, like Ellen Moon spoke about in the first slot. My boys are also good mask wearers. They use good hand hygiene, and they know how to cough into their elbows because they've been taught those things by us at home. Interestingly, they've also become quite good at social distancing, so much that it worries me a little bit. We have to get back to a little bit more reality with our children so they grow up to be healthy. My husband and I are essential healthcare workers who have been working the whole time and cannot be at home. And I just want to say that we need to return education to essential business for these learners and for all learners. Thank you.
Thank you. Mr. Technology, we have 5 minutes left.
Hello, my name is Denise Erickson, and I'm speaking specifically about high school. At this point, I have a sophomore and a senior. Do not want either one of their years to be ruined, but I'm also very concerned about how they are going to be social distanced and kept safe within the high school. Even if a third of the children choose the virtual option, which I've looked at, I feel that I cannot find enough information that this program is proven. My daughter is in advanced placement classes. The ones that she's supposed to be taking aren't all available. And I do feel my son needs some face-to-face interaction, but I don't know why we have to start off the school year with everybody in the school. I feel maybe the younger kids could be safer. There's more social distancing. You have the ability in the grade school and maybe even in the junior high area, but why at the high school where we're going to throw 1,500 kids or even 1,000 kids into the 10th or 12th grade center? How are they going to social distance? Masks and hand washing, I don't feel is safe enough, and I don't think it's been thought of enough about how we are doing that and what the plan is. I would like to see some type of split with them where you have an A-B schedule 2 days a week, or even after a couple weeks, if we feel it's safer to put them back into that option of all time. I'm not 100% virtual. I'm not 100% back in school, but I would like us to give a little bit more thought about it. I do adult education, and every one of our in-classroom classes have been stopped. We are not even doing anything until 2021, and I work for a company that has over 250,000 people globally, and we have moved everything virtual, online, and no classroom. So why are we endangering our children? And even if one child in the city of Oak Creek dies from COVID, that's one child that we could have saved.
Thank you.
We have one final speaker.
Perfect. Thank you. Perfect. We only have 3 minutes left, so works.
Hi, my name is Tammy Burke, and I'm a resident here in Oak Creek. I have 4 children between the ages of
5 and 11 years old. I have a child entering kindergarten, a child entering first grade, a child entering fourth grade, and a child who's super excited to start middle school this year. I've been paying attention very closely to all the board emails, updates. Quite honestly, I was alarmed when I was alerted by a friend on Tuesday night after the Monday night board meeting that there was a special session all of a sudden that popped up, even though the email on Monday night said our next session was on August 24th. We had said in the beginning that all of the emails and everything was going to be transparent. And I don't think that this session tonight was as widely distributed as it should have been. That being said, I am a nurse. I've been working in one of our community's largest healthcare systems for the past 10 years. I haven't stopped going to work at all. We need to look at the overall numbers. We need to see the instance of COVID patients that have been hospitalized in our community. They've continually trended downward, even during the reopening phases. Wisconsin itself has an extremely low percentage of hospitalizations as of today, and an even lower mortality rate. It seems people that have forgotten the original intent for flattening the curve, which was to not overwhelm our healthcare system so we could continue to care for the large demographic of our patients who have chronic and serious health conditions, as well as those who have emergencies. There has not been one day where our COVID inpatient census has topped 85 patients. And that's in one of our 3 large healthcare organizations in southeastern Wisconsin or Milwaukee. We have over 1,000 beds total. If you do the math, it's roughly 8% of our total patient capacity.
Tammy, you have 1 minute.
I'm lucky. I still have my job. My husband, not so much. His background is an executive in the restaurant industry. It's likely he won't obtain another career in this field this year, maybe not next year, maybe not ever. For schooling, that's a blessing and a curse. If school's virtual, he'll be home. My kids won't thrive doing that. They didn't thrive this past spring. With that, it also comes many decisions on what we do for as a family. I have to go to work. Our kids aren't old enough to stay home 5 days a week and be expected to do online learning. My kids have attended day camp all summer long without masks and then with masks with the mandate, and not one person has COVID. We need to look at geographical areas, outbreaks, and not be pressured by social politics and the minority to do what we think is right. If we don't return to school now, then when? Thank
Tammy,
you.
you have 5. Thank you. Thank you. All right, now we have one in our district office. Turn over to them.
Right in the, right there, right, yeah, that nurse. You may go one at a time.
Hello. My daughter's entering 5K kindergarten, and there's just a couple brief things. One, I would like to say, please don't let the grading that was done cloud your judgment. I think it's not fair and biased. 2, daycares and day camps, they have been open. Daycare is much longer, day camps all summer, my daughter goes. There's not one notification of an outbreak, okay? 3, I work, so does my husband. How are we supposed to teach my daughter? It's gonna be rush, and anger and fighting, just like the end of last year where I ended up backing out and just saying, you know what, hon, my relationship with you is more important. I would rather not ruin the good relationship I have with you by arguing with you every day and you saying, you're not the teacher, you don't know. And I can't afford daycare. Not many people can. So if it's gonna be closed, help us out then, because we can't afford it. I think that parents need to be able to choose, and these kids are our future. They're supposed to take care of us, and they deserve the same education that we got. And I don't feel that they're gonna get it if they're at home. I'm not a teacher, I'm a mom, and I work at a dealership. I did not go to school to be a teacher, and I wanted to be a mom and raise my daughter and have fun and enjoy the time with her, not argue with her to try to get her to learn and do her work. That's your job. I mean, not yours, but the teacher's job. It's not mine. I just want to love my daughter and provide for her, but not the whole education. I don't mind helping, but the whole thing, that's too much. Thank you.
Thank you. So thank you for everyone for all your comments. And again, like Dan has, Superintendent Dan said, stated before, every board member has all the responses. And so we appreciate all the feedback. And again, thank you so much. We're going to reconvene from the public input into action item. On agenda number 5, consideration possible action of phased entry and reentry criteria for 2020-21 school year. Do we have a motion? Right?
No, I'm Mr. Carini. I'm going to present this entire
Okay,
packet here.
okay.
We can have a motion and then robust discussion around the entire thing. Mr. Cromie's going to present now. So I'll just say for the folks who are watching and the people in the room, the format's going to be a little different than what we're used to here. We have a approximately 9-page document here where we're going to go into a lot of different wide-reaching areas. Okay. At the end of this is some sample motions, but you're by no means confined to them, right? It represents the most current information we could provide for you tonight. Joining me is Darcy Du Bois from the City of Oak Creek. She's our public health officer, and Dr. Stephen Jereb. He's the Oak Creek Franklin School District medical advisor. And at times they might help me present some of the more technical details of this report, or they're also here to answer some of your questions as we go forward. So we've got some guests tonight. What I'm going to do is methodically work my way through this document. I'll invite your questions, of course, at the end. And this represents, like I said, the most current information we have available. So if you turn your eyes to our display here, or Mr. Cromie starts presenting, the following report builds on some prior communications. And I'm going to share this evening, whatever the outcome of our meeting is tonight. I'll send this and a summary letter to our entire community. When I press send, I have said this before. When I press send on one of my messages, it goes to roughly 13,000 email accounts. So this evening, at some point when we finish up, they'll get a letter from me that I'll write no matter how late this meeting ends, and a link to these meeting materials so people can work through them on their own, right? And I feel like between that, our survey information, the roughly 300 public comments we received tonight, we have a lot of information to wade through this evening. So as I've said before, all of our prior communications continue to be linked on our website. So if people would like to see like a cultural anthropologist's review of everything that's happened since March 13th, they can visit that website and check it out. And we continue to update our FAQ as quickly as we possibly can. I'll note that the team here at District and our administrative team writ large, our administrative assistants, our buildings and grounds team, and many of our educators have been working nonstop throughout a time of the year that usually has a very different flavor. Right? Summer is a little bit different in education. One of the wonderful things about this profession is that you almost always get a hard reset in the summer and renew yourself for what's to come. This summer's been a little bit different, and I applaud the work that's been done by my colleagues and the people that fill these offices day to day, and the teachers who are following all of this and watching very carefully, and the support that we've received from our families in this district has been incredible. The resilience, our kids finishing the year, our families' patience with us as we approach the beginning. And I'll note that our community isn't unique in that. You see these conversations taking place all over Wisconsin and the nation, frankly. A very similar discussion to the one we're having tonight took place in Greenfield on Monday, Elmbrook on Tuesday, Waukesha on Wednesday, and here tonight in Oak Creek. We're going to examine some very similar criteria, and we're going to look at some of the same heat maps and statistics, and we're going to hear a bunch of new words and learn a bunch of new terms that have been floating around Wisconsin a lot more heavily right now. So I'm just going to, with that, just start working through this, okay? I hope to answer a lot of the questions that I anticipate you asking as we work through this report. But if you just keep track, we'll go as long as we have to tonight. So I've got 2 bottles of water, and I promise I won't lose my voice until we're done. So, all right. So all of our prior communications, like I said, are on the website. You all know we've been working very hard on the 5-day-a-week return to school with safety precautions in place. And we've been very clear that we're also preparing for the potential for intermittent closures, for quarantines. We know that's a potentiality. We've experienced that. And while I won't get too specific in the groups of students or the number of staff, we've had those quarantines quarantines, throughout our summer programming, during our sports offerings in July, right? We can reasonably anticipate this continuing, right? That's one of several reasons for bringing this information to you this evening, right? We've also very thoughtfully prepared for a fully virtual option that gives our parents some good choices and allows us to temporarily expand our workforce in a way that would help us bring down the total number of students occupying our buildings as we go forward, which helps us to socially distance, right, and support some of the measures we've been dutifully working towards that you've seen outlined in a number of prior communications and that we have planned for subsequent communications. So below are criteria that we have collaboratively developed with our local health department and medical advisor specifically for the determination of potential closures. I wrote that without data and metrics, we run the risk of being ordered closed with limited time for families to plan and without clear criteria for reopening. I think it's important to remember that there are organizations beyond this room that have statutory authority to close us and responsibilities and work to execute, right? It's important that we are aware of what those metrics might look like, and I think we can reasonably foresee that some of them are being previewed in this report. The DHS was rumored to be releasing a number of other criteria soon. We were told a couple of days ago, we're told at some point quickly, and I have it on, I've been told by regional public health officers that it shouldn't deviate. They don't expect it will deviate significantly from what we're looking at tonight, right? So this is a late hour for this discussion. I agree. It's not where anybody wanted to be, but we think this might be some of what's coming for us. So we should look at it as soon as we had it together. That's why it's in front of you. Another reason for seeing this tonight is some of you who are avid consumers of media, just a week ago, I think it was Thursday, when the latest data release was made, Oak Creek was identified as having a significant high number of COVID cases. It made all the local news channels, and I was asked to give comment to at least one. And that's part of the reason why all this is happening right now. Like, we have a number of pieces of information coalescing at the same time, right? Oak Creek received particular scrutiny for its COVID numbers in recent days, and the regional health officers that have given a lot of the criteria that you see in neighboring communities have shared it with us as well. So it's here for you to look at, to think about, and for us to talk about. We've heard from families and staff curious as to what criteria would be used to determine closure decisions. We know that many families who want to return to face-to-face instruction are also anticipating closure orders. We know that's one of the backyard conversations in Oak Creek, right? Like, before we had this special meeting, before we introduced this material, myself and a number of other people in this office spent endless hours on the telephone with folks talking through their own individual challenges, as evidenced by the over 300 individual scenarios that you were given and asked to wade through for this evening. Each of those stories is unique, and it is not infrequent that we would hear from someone, well, we like this idea, we're hoping for the best, we're trying to get those doors open, but I'm getting ready just in case. Or we're talking with our neighbors on who's going to take turns when our kids are quarantined, or when you guys eventually get your doors closed. I've heard that on the telephone many times, as have some of my colleagues who are nodding their heads behind us. So we know people are thinking that too. We've reached a point in fall preparation where the absence of essential criteria for opening and closing of our schools has made logistical and contingency planning extraordinarily challenging. That's a lot of big words, but it means, well, when are you going to get closed and what are we going to do, right? We have to have scenarios for all those instances. And as hard as I have worked this team already, they're willing to work still harder to continue. Like, I don't have anybody who's ready to quit. Like, everybody's buckled up and ready to work till the final hour, right? I have people who have foregone their vacations and lost days and showed up night and day. I've got people practically living in this office, and nobody's complaining, and nobody's saying that's not what I signed up for, right? This office is full of people who don't have any quit, and they're mission-driven folks. Like, you don't do this kind of thing for a living if you don't believe in the value of public education, and you don't believe in the power it has to change the life of a young person, right? And I can tell you, I feel comfortable speaking for our staff and stating that everybody wants to get back to their kids. You all know I'm a former English teacher, and the most magical professional moments of my life have occurred in the classroom. right? Working with young people and understanding where they're going and what they're wrestling with. And I want that for every family, every kid, and every teacher, again, as soon as humanly possible. As I noted before, we have seen a number of school districts throughout Wisconsin examine similar criteria to those listed below. Logically, such criteria would be used by public health to consider closing our district. So what I'm going to show you is likely what we'll be looking at come fall. It's reasonable to anticipate and review it now. Okay, engaging timely with these criteria can help potentially prepare for such orders. I noted that we're also under a new public health emergency order. We took a position on mask use that preceded that order, but that came along and kind of, I don't know what you want to say, like further strengthened or changed the necessity or mixed up a little bit, but I put that in there too. And like I said, we anticipate the release of a decision framework. That's what I've heard it may likely be called from the Wisconsin Department of Health Services that should be reasonably aligned with what I'm about to show and share with you tonight. So I would expect, if you are watching this or thinking about this tomorrow while reviewing the live stream, and you're an avid consumer of media, the conversation we're having tonight, I would reasonably assume that these conversations are going to continue to unfold in school districts all over Wisconsin, particularly southeastern Wisconsin, in the days leading right up to the first day of school. Right? I don't think Oak Creek is at the tail end of these talks. I think we're right in the middle. Our goal, as I mentioned, remains to reopen our doors and return to as close to normal operations as soon as possible, as safely as we can. And if you'd like to look at some of the mitigation measures we've laid out already, they're available on the website. And again, I'll highlight the work Buildings and Grounds has done in their procurement of PPE for people who might not have it or for our staff who need it, and for various different cleaning apparatus, sanitization methods, even finding new and innovative ways to disinfect and sanitize on even tighter timelines, and to do that within our existing workforce constraints. Like I've mentioned before, Oak Creek runs Buildings and Grounds 3 shifts a day at some sites, which puts us at an advantage to some districts who would really have to look at cleaning their facilities in a very different way, who don't have the luxury of being able to operate like that. Part of that has to do with our scale, and all of you know the dedication of the Buildings and Grounds team. Those are folks who didn't miss one day of work throughout this entire process. Buildings and Grounds has answered the call every time we've asked for them. If I go out to that maintenance shed any time of the day, and I ask anything, no matter how large the burden, I never get a no from Buildings and Grounds. Never. Okay. Should the metrics, okay, I'm sorry, I got to back up a little bit. I'm getting a little fired up here. I really like Buildings and Grounds. Okay. As long as COVID-19 continues to circulate globally, there's going to be risk to our community. You have to be clear-eyed about that. We all do. There will be risk associated with reopening schools until a vaccine or highly effective treatment becomes available. Listen, I'm an English teacher and an attorney and a school administrator. I'm not an epidemiologist, but I read what I see and I listen to the people around me, and I know that to be true. Okay. Should these metrics be adopted, additional prior planning regarding the potential for expanded school days out programming, staffing decisions, and or specific tailored supports at our sites for students and families during a given closure can be planned and communicated in advance. You heard from Mrs. Moon tonight, who's a member of one of our district committees as well. This specifically speaks to some of our students who are most vulnerable, who may need one-on-one interventions, and we want to be prepared to give those whether or not whatever format we're in exists, or to work with our Heather Ryan, who you all know, to expand school days out operations, if in fact you go down the road of picking one of the options that's laid out in this report. Right? The sooner we know with some certainty the path we're on, the more I can stress and tax the team to figure out creative ways to serve the needs of our community, regardless of what format we find ourselves in. I'll say I had a cabinet meeting with the team today amidst the phone calls and the other meetings. And I said, after I gave a preview of what we're talking about tonight, so one thing we'll know for certain is the course we're set on, and then we can set ourselves to the mission at hand. And if that means building creative solutions that address this paragraph right here, such as expanded school days out programming, working on staffing, which is a discussion that you don't hear quite as much talked about publicly, that we're perhaps facing the most significant sub-shortage in the history of education and staffing in general. You know that we've had a number of resignations, early retirements, changes to our workforce, and you all know that as long as I've been here, at least, we've been able to start within a person or two, a full staff, right, on a 1,000-person staff nearly almost every year. I would be lying if I told you I was confident that we will be full staff this year. Right, we're working feverishly. HR is not sleeping. We're getting creative, and our personnel reports are big every time you see them, but they're not big enough to fill the holes we have right now, even with our expanded temporary staffing through the through Edmentum or through the one-year teachers we've recently hired. And some of those we've lost recently too, because they've gotten jobs in other settings. So we're working hard on staffing. And it can't be stated enough that families need time to plan. As a father of 3 under 5, I empathize with this gigantic stack of public comments and everybody we heard from tonight. I don't know what the plan is in my own home. In sum, a potential framework and guidance for when to open and close school buildings is presented below. Potential, because as all of you know, local control is the phrase of the day, right? But here are some of the things you could expect to see subsequent, laid out for you to examine current. Right? So the current situation, over the past 4 weeks, the state of Wisconsin has continued to see a surge in COVID-19 cases. This is not my language. This is language that's been furnished to me from the group of public health officers in the region. This is some of the same information you'd see in South Milwaukee or Waukesha or other board presentations in the area. So like I said, I'm quoting and paraphrasing here. Currently, 60 of 72 counties in Wisconsin are reporting high rates of the disease. Milwaukee County is one of these counties. Districts throughout Wisconsin continue to review and respond to these emerging data. Oak Creek Franklin's no exception. So what I said when I was opening this presentation, we're the same as everybody else. We're responding to things happening very quickly around us. Local notes, the city of Oak Creek is experiencing its highest rate of disease since COVID began in mid-March. Additionally, here in Milwaukee County, there's been a significant rise in the number of COVID cases in children 5 to 17 and young adults age 18 to 29. Our community began seeing the highest onset of disease immediately following the 4th of July and continues to increase. The Public Health Department reports that the city of Oak Creek is on track to see sustained high level of cases. Right, so, and I put the heat map in here that's most recent. Like we got this information this afternoon. The Thursday data pull is what we've come to expect in these last couple of weeks. Last week's Thursday data pull is the one that garnered a lot of attention on local television. Right, so this is today. So you see blue in your lower left. Right, you understand geography, right? That's Franklin, and then you just cross over a little ways, and there we are in Oak Creek, and you can stand up the Lake Michigan shoreline and see what's happening around us. So these are confirmed cases of COVID-19 within the last week. So just a preview, if we act on some of the information that's presented here, we'd build a scorecard, right, where we could examine these data likely every Thursday or Friday when the polls come down. So we'd be able to put up a scorecard just like we measure student performance, review it with a team of professionals. If that's the direction we choose to go in tonight, we'd be able to look at something like this. In the past 2 weeks, the city of Oak Creek has recorded approximately 25% of the total cases since COVID tracking began in mid-March. The most concerning statistic is the growth in new cases occurring in school-aged kiddos. So we put that on there too. Right, I confirmed this information. Darcy shared it with me, the latest updates today, and we put it together for you. This next blurb, the pie here, this is families indicating the following selections for option A, blue, and B, red and yellow, in our most recent enrollment preference survey. So as a lot of parents alluded to, this is a snapshot that holds pretty true today as people continue to select and choose. And you can see what our community is looking for from us. Okay, so if you want to break this down a little bit further and do the math again, I asked for a current data pull right before I walked into this meeting, so you had numbers beyond the chart. So we have approximately 1,600 total students that selected a virtual option. Right? So 1,600 of our approximately 6,500 kids. So you can do the math, and that chart is still pretty close. But if you get down into the exact numbers, you could get it even closer. Of those students in the survey, the team included a third question that said, if things change, right? Because we've been trying very hard to hit a moving target and anticipate things as they come at us. So we asked, if things change, would you be likely to change your selection, right? To go back to something else. And we had, at last count, I think it was 508 of those 1,600 said if we went in a different direction, they'd probably pull back or reevaluate their choice. So that number may be as low as 1,100. That just gives you a sense for where people are. But like I said, this is a moving target. You all know that the first survey we gave much earlier in the summer, that preceded a lot of the changes and a lot of the pretty kind of scary news reporting and the things that like shifted below us. So we're watching this move. Okay. We're going to get a little bit more scientific here. Like right now, I'm comfortable because I'm quoting source material from other places that feels familiar to me. But now we get into a world that I'm not as deeply versed in. The next part is burden of COVID-19 status, which, as I understand it, is a number of COVID-19 cases in a 14-day period. Right. And following this grid right here, where we block out high, moderate, and low, you have a chart, right? This chart is supplied by the Medical College of Wisconsin epidemiology team, and it's part of the release that the Oak Creek Public Health Officer shares with us at the end of the week when the poll is complete. So if you're flipping between page 3 and 4, you see that chart. And I'll note that this isn't Milwaukee County. This is the jurisdiction of Oak Creek. So this is specific to Oak Creek. This is the current table. And you see that we found ourselves in that light pink, moderately high region running up to the 4th of July holiday, right? And after that, we saw a change. Darcy, am I explaining this correctly? Is there anything deeper on burden that we should be going into so we can kind of grasp what we're looking at here?
No, I think you did a good job. So when we calculate burden, we're looking at the number of new cases of COVID-19 over the past 14 days. And we use that over a denominator of per 100,000 residents. And that, even though we don't have 100,000 residents here, that allows us to compare our burden rate to other jurisdictions. So we look at the number of new cases, and exactly as Dan said, you know, we were managing pretty well until the 4th of July. And since then, we've seen quite a large spike in the number of cases, and we have found ourselves remaining at that really high level. We have not seen much of a drop. Many of the other suburbs in Milwaukee County have seen that number start to come down. Could
I just interject and ask Andy to toggle back to the heat map for a second? So kind of to illustrate Darcy's point. Right, we see ourselves and we see where we're situated geographically. So sorry to interrupt, but I just wanted to point to that.
Yep, they go together very well. So that map shows us that Oak Creek is still in the red zone. We're in the hot zone with one of the communities in the county that continues to see the highest number of new cases week after week. One thing that's really important to remember as well is that we know that many, perhaps most cases of COVID-19 are undetected. So we know that many people are asymptomatic. We also know that many people do not get tested when they have symptoms, or maybe one person in a household gets tested and the rest don't after they come down with symptoms. And so it's really important to remember that the number of actual positive cases in our community, as well as other communities in the region, are likely much higher than the numbers that we're able to report based on lab test results.
Okay, thank you. The second metric I'll highlight that you could see in our plans or plans that are adopted regionally is the percent positivity. So the percent of COVID-19 tests conducted during a time period that were resulted as positive. So according to local public health and multiple public health sources indicate that less than or equal to 5% is ideal for permitting schools to meet in person. I believe that's still the most current recommendation despite the fluid nature and changing updates that we're receiving day to day. The city of Oak Creek's current percent positivity, and we checked on this right before the meeting, is 9.56%. I believe that's still where we are. Okay.
Correct. And can I just jump in and say,
please.
So the reason that we look at this indicator is that because the person indicator of if we're doing enough testing in our community. So when that percent goes lower, we know that enough people are getting tested to give us a pretty good idea of the number of cases, and to know that we're detecting most of them and we're able to keep those people who are sick or those people who have been exposed and might infect other people home. When that percentage starts to go up, it's an indicator that we're not seeing enough testing. So likely, as I just mentioned, many people who are sick are not getting tested. And that concerns us because we are worried that there are people who are infectious or contagious who are in the community and who are continuing to spread disease. And therefore, it makes it harder to get a handle on stopping the spread of disease.
So we added a little additional supplementary information here. Dr. Jereb joins us from Oak Creek Pediatrics, and he shared some numbers here that I'm going to ask him to share with us that might help give us a little bit more local, zoomed down perspective.
Sure, thank you. So to follow up on what Darcy said, looking at for our organization at Oak Creek Pediatrics, and our positivity rate is much lower than what is being reported for the city of Oak Creek. So our positivity rate for the year is 3.65%, but for the month of July is 4.42%. So we saw a little bit of a spike, not as much as what the graph shows for what we've seen after July 4th. But I'd like to caution that our numbers are lower, but there's probably several reasons that our numbers are not in line with what we're seeing for the city of Oak Creek as a whole. Unfortunately, even though we're a healthcare organization, we struggle with testing supplies just like everyone else. So we are very limited on the number of kids that we're testing, and we are only testing kids who meet the DHS criteria. So that's a long list of symptoms, but including fever, sore throat, congestion, runny nose, diarrhea, muscle aches. So we're only testing kids who meet certain criteria. But in addition to that, many of the kids that we know are symptomatic who are calling our office, we are not bringing them in to be seen, to be swabbed. Again, we don't have the testing capability to be testing everyone. So to follow up on Darcy's point, we have a lot of kids who are being quarantined at home, who are symptomatic, who are not being tested. So the number of people we're testing and who we're testing is going to affect our data. And the testing that we're doing within our office is not enough to understand the true prevalence of our community. Again, we're selecting a certain small subsection of kids who are being tested. And we also know that kids may have milder or fewer symptoms, and many of them may be completely asymptomatic. So if they are not having any symptoms, we are not swabbing anybody who is asymptomatic unless it's required for them to attend school or daycare. So some organizations are requiring a negative swab before they allow kids back in. So we're trying to accommodate that as much as we can with our limited testing capability. But I'm sure there are many kids who are symptomatic as well as asymptomatic that are not being tested in our office, which will be affecting this positivity rate.
Thank you, Dr. Jereb. The third metric I have listed in the paperwork here for you is the COVID-19 cases. This is the 14-day trend in percent positive COVID-19 test results. So you see this, if you overlaid this with the burden map, it would look like they fit together well, right? The metric aligns with the burden of COVID status, but describes the trending of positive cases, not just the rate. Right? The metric is available on the City of Oak Creek COVID-19 dashboard. So a bunch of this stuff, and I have linked later for folks, you can go to that actual dashboard like many municipalities have, like the city has as well, and look at these things for yourself. So we just wanted the most recent graph for you to look at this evening. Did I miss anything, Darcy? Does that? Okay. So age groups 20 through 59, too, we aggregated those groups, presently have the highest number of cases. Most of our parents and staff fall into this age group. I'll just note that. So if you pull up that dashboard and look at, well, who's being affected right now, presently, those are the bands. So care. You've heard this other places, at least I have. Like I have neighbors who work in healthcare, and they've talked about this for a while now. Like you'd hear someone say we're on green status or something like that. To drill down on that a little more is the percentage of hospitals not in crisis care and percent of hospital beds available. We know that hospitalization is a lagging indicator from cases, but it's an important metric that indicates the severity of disease within the community. And like I said, this is also available on the dashboard, and I noted that all these criteria were taken directly from regional public health officer guidance. So these are shared regionally. Like this document right here, it isn't just an Oak Creek thing. Like you could pull these for all the municipalities in the metro area, I believe. Perhaps not without as much specificity. Like if you start to get a little further west or north, you might have a county authority versus a municipal authority. Like they might not be able to call a Darcy like I can if we need to talk about a number of the other things we've referenced tonight, or in prior years where we talk about things like pertussis or chickenpox, right, in different happier times. But you'd have to circle back on my original point, most places would be able to look at substantially similar metrics. I mean to say these aren't organically homegrown. These are universal accepted standard metrics that I think a lot of people have been looking for a while. Limitations. Now these are my words here, right? And we've thought about this for days now, and I had instincts to try to drill down on this further and further, like into school-aged populations, into our staff, to get into the city of Oak Creek proper, to get this as narrow as possible, and it gets very complicated very fast. So I said making distinctions between county and community data, and making distinctions between community data and school-age children data and our workforce data is challenging, to say the least. Milwaukee County data is helpful, but it has limitations when applied to the city of Oak Creek. City of Oak Creek data is helpful, but it has limitations when applied to school-age children data and our workforce data, kind of how we've illustrated as we've worked through these charts. So combining these data are critical to making informed choices, which is inherently complicated and without clear, centralized, easy answers. Like I can't download a federal or state template at this moment for a criteria and put it in front of you. We're in this position where we're aggregating these things quickly, where local public health officers are collaborating together to bring these things to us. There isn't a form I can go to on some state website and download it and put it in front of you and say, okay, let's score it and see where we are. And I noted that we're a public entity with a combined student and staff count of approximately 7,500 folks. So every day when we open our doors, people drop off their most important people in the world for us to take care of. And we open our doors to 1,000 staff that we value very much, and we exist within a community. So part of it was, how far can I drill down for you tonight into our specific staff and student count without thinking about how that extends to the broader community, how it starts to web out. You understand the point I'm trying to inarticulately express? Like we're 7,500 people in a 35,000 person community. So I was trying to note that there, and I stumbled over my words a little bit, but I'm just trying to say there's limitations and it gets complicated. I did note too that regional data is important because some of our kids and a bunch of our staff travel from beyond the city limits. So all that said, here's something for you to look at tonight, right? This looks similar to what, like if you're an avid consumer of media and local news, this looks similar to what's been introduced in some neighboring communities, and that's by design, right? We've picked and chose. I like to draft from precedent, right? So I'll find things that have been used successfully elsewhere. We'll rely on authorities and we'll bring it together, right? So we tried to fit the puzzle pieces together for you all to consider tonight, to think about. So I said phases for consideration. Phase one, once criteria is met, all students who selected option A, which is the 5-day-a-week return to school with safety precautions in place and the potential for intermittent closure, would transition to remote instruction. So let me say that again. Like if you were to apply these criteria as presented, and we were to look at the data table as it stands today, like look at that scorecard I thought about, that would mean all those folks who signed up to go in person, we'd be phased into a remote start. Okay, these are the criteria that we've kind of laid out here for you to look at. We look at number one, the COVID-19 disease burden for the city of Oak Creek. It would have to fall within the high level. So if Andy could toggle back up to the graph, keep going, that one right there. So that's high, that large portion of the graph right there. And the last time we weren't in that high rating was prior to the 4th of July holiday. So please scroll back down to the first phase. The second would be the average city of Oak Creek % positive test rate exceeds 5%. And like I said, that was the source data we could find and pull together. Said 5% was that cut score. Cut score is language I'd normally use to talk about star reports or something else when we're talking about student performance, but it seemed like a parallel that we could understand, right? So that 5% number is the one we look at. And right now, I believe it was exceeding 9%. Okay, so those are the two key pieces of criteria that we put together for you to look at here. But there's other items that are persuasive as well, perhaps not binding, but persuasive and valuable to consider in the context of making a choice this large. So we said subbing and staffing shortages. We don't have subbing shortages to share with you today because obviously we're not in session, right? What subbing's gonna be tough this year. Like, I'm not gonna lie to you, it's gonna be a challenge. Like a lot of the conversations we're having regionally as superintendents are, what are you doing for subs? And days back when I said we were hiring a group of limited term folks that would either work in a virtual setting or work for our existing sub pool, there was a lot of envy in the region and people who decided that was a good concept to get into it early. We also work with teachers on call, and we anticipate they're gonna struggle to get folks, but we don't know what that looks like today. So I can't plot that on a scorecard for you. Staffing shortages, I alluded to earlier, we are doing the absolute best we can. Like, I think that we could have enough staff to open our doors, right? So I'll tell you that. But once we open them, I don't know how that proceeds, right? I don't have a crystal ball that would reveal that to me. The COVID-19 disease experience for school-aged children, and we would look at that. And if you wanted to talk about that a little further, Dr. Jarab and Darcy could speak to that. The trend in 14-day COVID-19 % positive test results. So we'd look at that table. We would talk with the Oak Creek Health Department regarding their ability to contact trace. What we learned during summer offerings is that, like, we really have to work hand in glove to help facilitate contact tracing. It's burdensome, right? I'm learning more about it every day, about what our involvement would have to be. And contact tracing, to be effective, as I understand it, needs to occur as quickly as it possibly can. And once we reach a place where it becomes delayed or it takes many days, and I want to make sure I say this correctly, like, the longer it takes, the less valuable it is. Fair to say? Yes. And then local hospital care rates, which, as I understand it today, wouldn't trip any of these criteria. We're in a good place there. So we would trigger the top 2 most critical pieces of criteria and some, but not all, of the subsequent persuasive pieces that are on here. But we tried to draw together some of the most important elements that we could that would indicate whether or not we'd be able to function. So I wrote this again to be absolutely clear. Again, once criteria is met, the 5-day-a-week return to school option with safety precautions in place and the potential for intermittent closure previously outlined in prior communications would be phased to start remotely. So that would be the consequence of accepting this criteria. If, based on these changes, any of the approximately 1,600 students who selected a fully virtual program no longer wanted to do that, they would be invited to update their enrollment preferences. So literally, when I go back to my office after this meeting concludes, I'd reference that in the summary letter if we were to do that, and then tomorrow, Monday at the latest, we'd begin to work through that, right? Because like I said earlier, 500 and some odd folks would likely want to adjust their answers. Like I said, we're doing our best to anticipate what's coming for us despite the sands or the ground beneath us shifting like sand. Phase 2. This represents where we would have been, I believe, prior to the 4th of July holiday. So not such a distant time from now. Phase 2, the COVID-19 disease burden for the city of Oak Creek falls into the moderately high to moderate level or below for a 2-week period of time. So back to that chart before that spike. And the average city of Oak Creek % positive test rate no longer exceeds 5% for a 2-week period of time. right? I believe those would have also been in that pre-4th of July place that we'd have found ourselves in phase 2. We also said no longer experiencing subbing or staffing shortages. We would be as creative as humanly possible to address that bullet, as we always are. The COVID-19 disease experience for school-age children, like I said, we're learning a lot day to day, and we haven't had the national experience of having our buildings filled with kids wide scale yet, so we're going to learn a lot nationwide. The 14-day COVID-19% positive test results, the city's ability to contact trace with our help, of course, and local hospital care rates. So redundancy from prior bullets. Also, I noted that we would assume that in collaborating with the city health officer, that we'd be able to share our plans, as we have been doing frequently in this entire run-up. Our mitigation measures, for example, all of this has been shared with the city public health officer. We would continue to do that, and I would assume if we get to this place, we'd be able to collaboratively arrive at a place where she'd say, yep, looks like you're doing everything you need to be doing, and giving us creative ideas from the health professional world that may not have occurred to us as education professionals. And we would continue to talk with Dr. Jarab regarding Oak Creek Pediatrics percent positive rate and their experience, what they're learning locally. So to have a resource like him to rely on, we would be remiss if we didn't include that consultation in any plan that we implement. This is where it gets slightly more complicated and begs a great deal of questions, right? When phase 2 criteria has been met, students would begin to transition to in-person learning. I'm going to talk about elementary first. If you chose to go down this road, we would be able to bring back our elementary students, our 4K5. As you know, as we've talked about, it's a lot easier to cohort those students, to group them together, to facilitate any contact tracing or quarantines that may be required, and to continue education if they were sent home, right? Logistically, right? Elementary doesn't pose as many challenges as secondary does for operating within the recommendations and best practices that we've learned and that have been shared with us. So if we get to phase 2, 4K through 5, we're going to open it up. Now, conceptually, what does that look like? We'd probably walk our way into it. Maybe we bring back 20% of our kids a day for that first week. Of course, there'd be a lot more information on this to come, but to begin to acclimate kids to that change. Like I said, if you were going to do this, we were there right before the 4th of July, right? And we'd have to step our way into it thoughtfully, but we'd bring our elementary kids back as quick as we could. Secondary students, grades 6 through 12, would return to our high school and middle school campuses using a hybrid model of learning, which we haven't talked about much here in Oak Creek, right? That would be a major discussion and communication campaign that we'd have to embark upon, modeling, lots of information sharing that we've had the team working on in terms of contingency building for a little while now, but that would have to be shared writ large with everybody pretty big, pretty fast, pretty soon. Hybrid model of learning, which would combine face-to-face instruction with remote learning. In the context of COVID-19 school reopenings, this model would reduce the number of students in the building by moving some of the course delivery remotely. Now, you've seen some of these plans in neighboring districts where they run A/B days. They work creatively to reduce the number of kids in their building any given day, and instruction continues virtually on the days they're not in session. So we had the team around this again today, just anticipating the possibility that we might find ourselves in this place at some point. So when I said at the outset of this conversation that we've been working people pretty hard, that's an understatement. So to build contingencies for all these different scenarios, it's necessary, but it's a heavy lift, right? But we're up to it. So there we are. So if we find ourselves in phase 2, we've got 4K through 5 up and running. We've got secondary sites on a hybrid schedule, 6-12 in there, in that format. Well, what happens next? Okay, because if you look back at that, model up there again, the grid, Andy, if you could scroll up to it. All right, well, what if it comes down a little bit more? What if we get to some of those earlier numbers in there? What if our experience isn't bad, right? What if phase 2 goes well, right? So if the COVID disease burden for the city of Oak Creek continues to fall within the moderate level or below, and the percent positive continues to no longer exceed 5%, And this is the key part of the green box. Upon phase 2 return of students and staff into the buildings, the schools experience minimal COVID cases as determined by the district and in collaboration with our health department and our district medical advisor, as demonstrated on our scorecard. Like when we get to that place, and we have some additional persuasive data that I've already talked about here, then we go back. Then we're all the way back. When phase 3 criteria has been met, students return to in-person learning 5 days a week. And I put a note in there too that students and staff would be excluded from in-person teaching and learning if and when they would test positive for the virus, or if they deemed close contact by the health department. A staff member or student would need to then follow the exclusion protocols set up by the health department. And that applies across the board, and it applied throughout our summer offerings too. I just put that note in here at the end to know that whatever we're in, like there's going to be kids in all likelihood who are quarantined, right? Whether it's phase 1, 2, or 3, or you reject this entirely and we go down a totally different road, we're going to have kids that are at home throughout the year that we're going to be working with, likely until we've got a highly effective treatment or a cure or something that, you know, a guy like me just can't anticipate despite our best efforts. So I would imagine that's our, as one of the public commenters said, this is going to be with us for a while, right? So this is a new feature of the work we do. So Dr. Jera, Darcy, did I gloss over anything or mess up any of these data points as we walked through? Anything you'd like to add before I talked about how we might proceed and make some decisions? Did I botch anything here?
No.
No? Okay. Feel okay? They've been collaborators all the way along. I just, I'm very happy they're joining us here tonight, and they're extending their expertise and their time to all of us. This next part, the block I entitled Decision Points, the team thought about this, and this looks similar to what some other, can you hear me? Okay. Okay, I'll keep talking. I think we can still hear me. So the decision points box, we look to what can we reasonably implement on what sort of a timeline, right? We think about this like a switch that you flip on and off, and consider how disruptive a switch could be to a system as large as ours, right? Mr. Bennon, who coordinates technology for our entire district, will talk about some of the systems we use being like turning an aircraft carrier, right? There's 1,000 people, there's 6,500 kids, there's programs, there's transportation, there's millions of pieces of this pie that we put together to call a comprehensive educational experience, right? So this decision points matrix, it represents turning a dial, not flipping a switch. So if trend data, I wrote here, trend data must be trending down over at least 2 consecutive 2-week time periods to make a switch. If we have 2 consecutive 2-week downward trends, then we'll make a decision to switch models after the following 2 weeks. So those of you who are familiar with my other data-based presentations, when we talk about a PDSA cycle or cycles of review, the interval of review for this, as I've laid it out here for you to consider, is a 6-week interval, right? A 6-week interval. Now that could likely be compressed, but every time we compress it, the challenge on the system grows greater, right? You have some very good people here that will work as hard as they possibly can. Like, we are willing to be taxed and stretched and pushed, and we'll work as hard as we possibly can. I just chose 6 weeks as an interval because that was a familiar one in the region. I know South Milwaukee operated on a 6-week interval. I believe Waukesha presented a 6-week interval. It just seemed like a reasonable period of time, and 6 weeks puts us preceding the conclusion of the quarter, which also from an educator point of view seems to matter. Sorry, Leah, go ahead. Yep, I'll do it again from the top. Okay, so yes, so just say we're going down this road, all right? It's going to take us time to implement it, right? That makes sense. Like, there's a lot of pieces to coordinate. We'd have to gear up in all sorts of different ways. So that data that we were looking at before, it would need to be trending down for 2 weeks, right? So if we put out the scorecard and I share it with the board, or we put it on the website, or whatever we chose to do with it, and it's a Friday, our Thursday data came in, and bang, we're right there in phase 2 or right there in phase 3. We're going to need a minute to make sure that it isn't just an anomaly, that it's what's actually occurring, because I don't know, I think about childcare burdens, I think about transportation hurdles, all those other reasons that we'll have to think through if we're flipping back and forth. Like, that's a jarring experience for everybody. Like, as much as I'll share, as much as I personally want to open these doors as fast as humanly possible, right? I know that if we turn the lights on and bring everybody in and 2 days later everything looks worse, like that's going to be very, very disruptive. Right. So I said that data should be trending down for 2 consecutive 2-week periods of time. So we get out of the gate, we've got those 2 consecutive 2-week periods, that's 30 days, right? And then we spend those next 2 weeks communicating and logistically planning for how we're going to open those doors, and that's a full 6-week term. Now, that paragraph, that I agonized over how to present this particular box because it's clumsy, right? It isn't, it's not snappy. It doesn't have like a 30-day interval feel to it. Or we're going to look at this at the end of, we'll be able to make a decision by mid-September for the end of September. But like I said, we can, if that's the path the board wants to take, we can talk about how we could work to condense this interval or play with this interval. We just needed a starting place. So, and to kind of sum it up at the bottom there, I said we would decide by the 4th week of school if we could move to a hybrid as of the 6th week of school. So if we can get to phase 2 quickly, like we ought to know by the end of the first month of school, right? So it's a point for discussion. Does that make more sense? Okay. I also put this in here too. I mean, it's important to note that we continue to hear that this is a novel virus, meaning that it's new and clinicians continue to learn more about it with each passing day. Like, if I had a tracker of the various conversations I've had with parents, the conversations have evolved tremendously from St. Patrick's Day to now, right? What we're learning, what's been shared, if I had a comprehensive list of the source data that people had emailed me, mailed me, told me about on the phone, like, it goes from a very narrow path to an incredibly large mix of information. I mean, I included some of the most prominent pieces that have been shared with us at the bottom of this document, like the City of Oak Creek's dashboard or the City of Milwaukee's dashboard, the American Academy of Pediatrics' most recent release, which was mentioned during public comment, the National Academy of Pediatrics reports here, something from the Academy of Sciences, Engineering, and Medicine. A lot has been made of a report out of South Korea and some updated CDC guidelines. So there's a lot here, and more comes out all the time. So to my earlier point, like, this is what it looks like today on August 13th. I mean, this is a room that is more than willing to examine things as we learn about them, right? That's been my experience with all of you as the years have gone by. Like, if there's new learning, we react to that new learning. So I said plans, practices, and recommendations continue to change, but learning's taking place. Reassessing will be necessary, should reflect new learning, and should be expected. So this is in a board report. And whatever we do tonight, I'm going to send this out to everybody with a little summary letter, right? But I would expect us to have to deviate from this. It pains me greatly when we agonize over a communication, try to send something out as soon as we possibly can, even knowing that it might have to change in a few days. Like, given our experience with this whole event, like, I wouldn't be the least bit surprised if by the time I got home tonight, it's midnight and someone's on TV and the rules have all been changed. Or tomorrow, DHS like does this much talked about release and it's much more strict or much more liberal or whatever. It opens it up or confines it down. Like, I fully expect things like that to happen, and we're going to have to be ready to react to that. And the team's up to that challenge.
Can I just jump in?
Yeah, please.
I really leaned on Dan to put that in the report because I think, as we all know, since March, as we've learned, as this has progressed, we have learned a lot about the experience of people with disease, about how disease spreads from person to person. We've seen the length of time of isolation and quarantine periods change. We've seen the definition of what is a close contact change. And I would expect that that will continue, because as we continue down the path, we only learn more, and we want to constantly revise that so that this pandemic is as the least disruptive as possible on our community. And so, you know, as a health department, I think we share your goal to get back to in-person learning as soon as it's safe for the community and for the families. And so as a result, we are constantly looking at data. We are constantly talking with the state health department and with the CDC to really to really look at if what we're doing is actually still the best practice. And so we'll see that change. You'll see the recommendations that come from the health department likely change, just like Dan said. And I think that's a really important point to note, is that this is probably not the last time I'll be here. This is probably not the last time we'll have this discussion. And I and the health department are committed to continuing to do that and continuing to work as closely as possible to have the best plan and the best services available for the community.
I'd be remiss if I didn't note how frustrating that is for people, right? Like, as someone who works hard to try to like keep everybody on point to make sure our FAQs are as up to date as humanly possible, it is not unusual for me before, like when I open my inbox for the first time in the morning, for a constituent to point out that our FAQ is already out of date. Like that's like a happy good morning. Like as I'm having coffee, it's like, oh, got to get in there. Mrs. So-and-so was sitting on the FAQ as soon as the DHS released its new whatever, right? But like we're committed to that, right? So Darcy being here tonight, like this is a long-term commitment, right? Like we need to rely on those around us. We need to respond to the to new information as it comes to us. I mean, that just makes intuitive sense to me as an educator who wants to be doing the best we possibly can for our kids at any given time, right? So point well taken, and that's why we got it in there. The final part that we put together for you to consider and look at were a variety of different actions that the board could entertain and undertake. So I just tried to write some stems. Like over the years, we've tried to bring options, and there's a bunch of them here for you to look at. The first one I said is basically amounts to you move to authorize us to go forward with what's presented here in front of you, right? So you could do that. Number two is you could do approximately that, but you could adjust some of the review intervals, and we could talk about how that would work operationally and how that could fit together. I know that might be something people might want to consider. You could table this for a later date. That's, of course, always your option. Or you could say, I like the original plan that we brought out earlier in the summer, stick with that one, right? That's an option available to all of you too. But we wanted to collect all of this information, put it together in one place, right? We wanted to collect these, all of these, and I have my camera off, but I'm holding in my hand for illustrative purposes, the stack of over 300 public comments. We wanted to bring this all together, even here at this late hour on the 13th of August, right? That I'll note is almost exactly 5 months from when we had to make the decision to close our schools in the first place, all right? And get to a place where we have a much better idea of what we're looking at for September 1st. So that's what I have for you tonight. I thank Darcy and Steve for helping us put this together, and we relied on a bunch of other people to bring together what has been looked at in a couple of neighboring communities for you to look at in a similar way. And whatever we do tonight, I would expect conversations like this to continue throughout the region and the state and the country on very similar topics, like that burden rate number and percent positivity. I would think you'd hear those on the news over and over in the days running up to the start to the school year and beyond. And now they're part of our vocabulary here in Oak Creek, Franklin. So that's my little speech for you tonight. So entertain any questions you have or open it up for discussion. We've Darcy and Steve are here to answer questions. Mr. Thielen and Mrs. Katarak are here if you want to ask questions about how it affects various areas they oversee. Dr. K is here to talk about our longstanding relationship with public health and how some of this would work going forward if you have questions for her. I'll note that she continues to join us in great service, even though she has complete ability to enjoy her retirement. Her unyielding dedication to this district is, inspiring for me. So she's here again tonight. So with that, questions or comments, we can entertain motions if you had them, whatever. Yes, absolutely. You can do that too. Okay.
Sounds good.
So why don't we take 10 minutes? Okay. We'll mute our mics and.
Oh boy. Oh.
Thank you for everyone's patience. I will turn over to Dan, Superintendent Dan.
Okay, so we're back from our brief recess, and we're at the point where if we want to entertain potential motions and then open it up for discussion, we could do so at this time.
We need a motion for number 5, the consideration possible action phase entry, re-entry criteria for your 2020-21 school year.
Is that the motion, or is that what we're, or is
No.
it 1, 2, 3, or
We need a
4?
motion. We need a motion.
So Niglia moves to.
It
Yes,
is.
it is, yeah.
Yep.
Can you hear me?
Yep.
It's very, very faint.
Oh, sorry. Can't see here. Okay, let's try this. Okay, so Niglia moves to, so I can choose one of the options, correct? Okay.
Wait. I'm sorry. I was muted. So Cheryl asked if she has to pick one of these motions. And I said, no, she's not restrained to these motions. They're possible motions, just some samples that we tried to draft up for you. So you could do one of these or you could do your own.
Okay. In order to generate discussion, I'm going to move for option 1 to authorize the district administration to apply the noted above that was presented in coordination with the Oak Creek Health Department and the district's medical advisor in order to implement a phased-in reopening of the Oak Creek Franklin School District.
And Darren, you second?
I've got it. I'm taking good notes tonight.
Okay. Do we have a discussion?
I have 2 questions. Dr. Jarob, I'd like to start by asking you if you can speak at all to parents' concerns in social and emotional well-being on the opposite end of, what their physical health is. I have 2 kids who I know have struggled a bit being home and separated, and that's something that I hear from a lot of families as well. Is there anything at all that you can speak to regarding that?
I can. I think to some of the public comments that brought this up as a concern, these are concerns that I also have as a medical professional. And the short answer is there's not an easy answer or a perfect answer, unfortunately, to that question. I think the risk of infection in COVID-19 to the kids as well as the teachers and the family members is a very real risk, and the risk of social as well as missing physical abuse, sexual abuse, the increase of depression or suicidal ideation, and food and economic security, and even as simple as decreased physical activity by not being in school are very real concerns that I have as a pediatrician for kids. So I think it's a balance between looking at those real health issues as well as the risk of COVID-19 for the students as well as the staff, as well as the parents and family members that they have at home. So I don't have a perfect answer to that. I think those are very real concerns. And as was mentioned in the public comments, that teachers are mandated reporters, and we worry about missing kids who are showing signs of physical abuse that are not, if they're not in school, to have someone else laying eyes on them. But it's balancing that with trying to keep people safe from a true infection risk and again, to the people that they live with.
Okay, thank you. My other question, Dan, was for you, and I know you've spoken to this a little bit before. Another concern that a lot of parents had was feeling that the remote learning that was done at the end of last year wasn't sufficient. And again, I don't think that's a statement meant to place any blame. We pivoted very quickly, and I think everyone did the best job that they could. I know that we've spoken in this past a little bit about synchronous and asynchronous learning, but can you again maybe speak even briefly about if we would go to a remote start, what would look different about this year from what they saw last year?
Sure. So I worry all the time, like you know that about me, right? And one of the things we worried about anticipating the fall was that we'd have large number of kids quarantined for large periods of time, or that we definitely find ourselves in some format where we'd have to be better virtual instructors, just somehow. Even when even it was early summer and people were more hopeful and the numbers looked a lot better, we thought, you know, we're going to have to put some chips in this basket, like with the experience people had in the spring. Families were extraordinarily understanding, but it wasn't the greatest experience in the world, and that's no secret. Like, we got pages and pages of feedback from folks. Our teaching and learning team and our principals have spent an eternity going through those comments that families were good enough to write. Most of them were pretty nuanced. They said, hey, it was an emergency. People did the best they could, but... And those buts led to a lot of really good ideas. In the same way we do continuous improvement in other areas of our practice, we said, what are the most frequent heavy hitters? What are the things that people noted over and over again? What are the items that we could do a better job with? And we've spent the summer preparing around those items in anticipation of having to be virtual at some point, whether it's to facilitate kids in a quarantine, or if we found ourselves in a place like we are tonight, where you're considering doing something much larger and more sweeping. So in anticipation of that, I've had the team this week working on the communication that would have to follow whatever happens tonight. So Friday or Monday, some of the information that we hit in broad strokes on the work study night, where Mr. Krennick came and presented some of the improvements and the items we'd be working to build in, we weren't particularly focused on it at that point. We were very focused on what was right in front of us, right? Coming back to school, looking at this comprehensive plan, understanding all this stuff in front of us. So John presented for a couple of minutes on some really important big work that he and the team and the rest of teaching and learning had been doing. So that needs to be trotted out again. Right? Like, if we find ourselves in this place, that's Friday or Monday's communication. I said that in a letter that I'm considering working on, like some draft information that I've got put together, I wanted to share with the community that we roughly doubled our professional development for the coming year. Like, I've heard it discussed in the community and other places that, you know, if we knew what we were doing, we could have spent the whole summer getting ready for it. We've wasted all this time. And I don't mean that about us. I mean that about education in general. Like, you could read that in a national publication. But here in Oak Creek, we took our normal professional development that we generally do year to year, and we took it all and put it in the summer months and had teachers do it asynchronously. So you may have heard this from some staff members, that they had various different training modules that they could engage with throughout the summer. And we doubled the allocation. Right, we required staff to work on it more often. If we want to get a little specific, a little more granular on what they had to do, I can give you some broad strokes. Like, Mr. Bennon designed some very specific how-to style tutorials for people on higher end virtual teaching. Like, how do you set up a synchronous and asynchronous classroom? How do you use different present modes? How could you better situate your Google Classroom to facilitate a more robust experience? Or how could we make some real brass tacks changes, like some synchronous teaching, some live instruction, some office hours. And Dan and Bridget are here as well, and I'm doing my best to summarize it. But Mr. Thielen, am I missing anything that I could, like, give people just a 10,000-foot taste of what you and your team would share if we ended up going down this road late this week or early next week?
No, I would just reiterate, man.
Yep.
Okay, I would just reiterate, and John is also on the meeting as well, but I would just reiterate the amount of time and energy that's been put into the training of teachers to the professional development, getting them real comfortable with Google Classroom, and just setting up a schedule based on best research and the amount of hours per day that we would, if we were going to remote learning, what that would look like, and the number of minutes of instruction in each of the content areas that we're focusing on as well in that. So it's become much more specific. It's much more focused. And, you know, basically going back to what's been the best thing about this has been time. We've had the time to put this in and make the improvements based on the feedback from what we saw in the spring and our own self-reflections.
We thought too that, you know, this might be wasted energy, right? This might be wasted time with all this professional development, but we reasonably anticipated that it was worth the risk, like given everything that was occurring around us, to put a lot of these professional development chips in this basket. Like normally we'd start the first couple of days of the year in an in-service setting, everybody's gathered together, we're doing a variety of different training, and we scrubbed that and changed it into asynchronous training that teachers could engage with over the summer. So like, and I'll say this to our teachers' credit, I wish Mr. Bennon was in the room tonight, but as soon as we released the digital professional development, he had something like, I think it was over 200 of the teachers who started on it, like within the first 3 days it was sent to them. And that wasn't the expectation. So like a ton of our staff just jumped right in. So teachers knew it too, that what we did in the spring, like teachers are conscientious folks, right? They wanted to do the best job they possibly could, and they were crying out for more, like what else could we do? What training is available to us? And our staff jumped right in. At the end of the day, I said to Dan and John, well, if we end up back in school 5 days a week and everything goes as well as we hope it will, at least we'll be able to run the best homebound or snow day program that we've ever been able to run in the history of this district. So no matter what, we're going to get something out of it. So that was a really high, like real high. But if we get to that place, we're going way deeper with our families very quick.
Yes.
Okay.
Cheryl, sorry.
Yeah, no, it's okay. Is there any way we could give families, I think they're looking for some more specifics, like how many hours a day would there be the expectation that their child would be in front of the teacher on this remote learning? I think they want some, if you can give us just some ballpark ideas, I think that's what some parents are looking for, correct? Yeah. Thank you.
So it will vary by grade level or grade band. So, at the younger grades, you're looking at approximately maybe between 2 hours and 2 hours and 15 minutes of synchronous instruction. As you get towards the middle school grades, you're probably looking closer to about 2 hour and 45 minutes of synchronous instruction. And when you get to the secondary level, closer to about 3.5 hours as it's broken down. And within that time is broken down by the minute in terms of instruction with the different types of courses that students are taking. So maybe 45 minutes of English, 45 minutes of math, 30 minutes of social studies, those types of things. So it starts out with smaller hours with the elementary students, and it grows as you get toward the secondary level.
And that's just the synchronous piece of the puzzle,
right?
right? There's
Exactly.
that asynchronous piece that flushes out the full puzzle for students. Right?
And would those lessons be recorded in some fashion? So if the family couldn't, be online at that particular time because daycare issues or whatever, that they could look at it at a time when it's more convenient for them?
Yeah, those things would be recorded. There'd be an opportunity if a student had missed something or whatever, they can go back as part of the asynchronous piece, or if a parent was working during the day and they wanted to follow up with their child in the evening about something that they were doing with a particular class, they can definitely do that.
And it's extraordinarily complicated. I'm sorry, Darren. I just want to make
I just want to piggyback. Can you hear me?
Yeah, go ahead. Yes.
Okay. I just want to piggyback off of Cheryl. So what happens if they have 3 or 4 school-age children at different grades? How does the family get all them synchronized into doing their 2 hours if they're all coming in at the same time, and the mom's there, saying, hey, you got your 2 hours. Are they going to, I don't know what they're going to do at home, but they all can't sit at the kitchen table and listen to the online learning, obviously. So we have a plan to let them know how to do it or something.
Yeah, that's a great question. There's going to be some challenges in terms of how we're going to be able to do that. I mean, obviously students are going to have their devices and so on, and as families can arrange within their home setting about how they can able to do that. And you may have a parent that may have to bounce around or whatever, but I mean, that's something we can explore further in terms of providing guidance. If you have multiple children at home all doing remote learning, that we're going to have to, help provide some, additional guidance on that.
Well,
It's going to be a challenge.
Darren, and I mean, no rose-colored glasses about this, right? I talked to a father a couple of months ago. He called me and he said that I think it was his 5th grade daughter was facilitating the education of his 2nd grade son and his kindergarten son while he delivered DoorDash. And like, I remember sitting in my office taking that call and thinking about like the unique challenges that each individual household in this community faces and how immense that is, right? Like, I'm going to reach to my favorite like stack of documents of the evening again, right? Like, there's over 300 unique experiences of people here, right? And that's just one dad I talk to. So while the experience I would expect and I would require of our teachers and our staff, and I believe they would rise to those expectations and meet those challenges, we do a better job than we did in the spring, right? Despite everybody's best efforts in spring, they didn't have the same level of training they have now. We didn't have the same level of preparation and time, but it's going to be hard, right? As evidenced by all these public comments. Like, there are some families who, no matter what, right, what we as an entity did, the challenges they face in their home are immense. So, like I said, like, this isn't good news by any stretch of the imagination for anyone. We do our best, like we always do. We'd make it better as best as we could. I know personally our IT team spent an immeasurable amount of time like helping people do tech support, like over the phone in the spring, and delivering devices individually in our tech trucks all over the community to people who were homebound or didn't have cars. Our tech director could tell you a story of driving out to one of the apartment complexes here in town, meeting a kid, and the kid, tears in his eyes because he's getting his Chromebook dropped off. I mean, this is our community, you know, so we do our level best, but this isn't going to be ideal if we end up in this spot. Okay. You're welcome.
I have another question. Based on the numbers we have so far, if we were going to going face to face, is there a rough idea of how many kids would be in our elementary classes, middle school, high school?
I know
we got some kids who are already going to do virtual.
Right. So I can give you a broad strokes, rough math, right? So approximately 6,500 total students. And as I noted before, I hope my memory holds up tonight, 1,600 students who had selected the virtual option. So you do that subtraction, and Mr. Thielen's nodding his head. I believe that in a rough approximation, they were spread roughly evenly across the grade bands. So it pulls them down. And because we're working with Edmentum, and because we hired a handful of year-long staff earlier, that those factors bring down our section counts together, right? It doesn't bring them down by half or something like that, like a hybrid model might, but it reduces them. That's one of the measures we were working on to reduce the total number of kids in any given class so we could better facilitate the social distancing recommendations. You know, you have a room with 26 kids in it. It's very hard to keep people apart during a given day. So that was one of the measures we were working towards to bring down our numbers, because I would think any district to expand its staff dramatically, like, it's a pretty serious challenge. So that was our first effort to do that.
Are we, would we be able to meet the recommendations for safe distancing of like 6 feet in our classrooms?
6 feet of space, Cheryl, I'd be lying to you if I said a high school classroom with current numbers, right, could meet that 6 feet recommendation. I don't think any comprehensive high school could make that claim despite their best efforts, right? That's part of the, when we released our position on masks before the governor's order came out, I was part of it, because we were told if you can't socially distance, you got to mask up, right? And that wasn't a particularly popular position we took at that time, but I think largely people understood it. And as the days went by, they thought, okay, that's the 6th biggest high school in the state of Wisconsin. If we're going to be passing between classes or moving up and down those hallways or sitting in a chem lab, right, that's the way it's going to be, because 6 feet, like, I'd need Steve Rohde in here to do the rough square footage in there, but it's tough, right?
And I have a question for maybe Darcy. How does this affect the private schools in our area?
So we have shared the same recommendations and metrics with all of the schools here in our area, and I believe across the county health departments have. Sorry, better? Yeah. So thank you. We have shared the same metrics and the same data with the private schools in the community, and I believe that's happened across the county, but each school is making their own decision.
Okay. Thank you. You're not on.
Can you hear me now? Okay, I have a question for you. Day 2, we're open, or any school that's open, and they're over 5%. Sounds like the 5% is the threshold, correct? Will the city of Oak Creek or any official from the state will say, we recommend that you shut down due to the high cases, and we will force you basically to go virtual?
So I will say that state statute does allow health officers to order a school or another entity to be closed based on the situation and how they're responding. However, it is my sincere hope, and this has been communicated to not only Dan, but also the other schools in our district, that this is really a collaborative process. I have no desire to order a school to close, and I think that through whether you're virtual or remote or in person, we've been having daily communication already. I anticipate that will continue, where we can share data, where we can really talk about, how do we best respond to protect the health of the schools and the families. So while it's something I could do, I hope to never have to do that.
Thank you.
And that's part.
No, go ahead.
I just wanted to say that, like, the collaboration Darcy references, like, it's self-serving in a lot of ways too. Like, if we just said, nope, we're good, we don't want to talk to public health, we're going to march forward with this plan we have because we have a desire to do so, because we believe it's in our best interests for a variety of good reasons. We could find ourselves having to retroactively look at this criteria and not have a deep understanding of it and not be as prepared to respond to it. So collaboration is the key word, I think.
And the only reason I was asking is just you hear that out in the public, and I just want to make sure that everybody understood that. So
Sure.
Thank you.
Yeah, so speaking of things that we're hearing out on social media and such, one of the things that I noticed kind of in the conversation today on social media was that Oak Creek so far had not had any problems with programs run by the school district with regard to COVID-19 or quarantining. And I know I'm sort of following up, and I have more questions that are more directed at you, but maybe if anybody in the district could sort of, for the public, hearing, kind of give us the quick rundown of what did happen in some of our summer programs with regard to COVID-19, quarantining, and contact tracing and that sort of thing.
Sure, I can take that, and I'm not going to be, I can take that, and I'm not going to be super specific for privacy reasons, but I'm going to try to give you a general sense in a broad way so that people can maintain their anonymity. So we ran the summer sports program, right? And we've run programs through our rec department and we've had to have quarantines in both of those programs. We've had quarantines throughout our sports teams, right? I know that I'm looking at a list right now of 5 separate ones from memory that we ran over the summer. All 5 of those on my list had to have quarantines of some or all of their students at one time or another. And we did have quarantines in our camps as well.
And were those quarantines because there were people that tested positive that were interacting with those students?
Yes.
Okay. So just for that, thank you for that. And then to follow up on that, what are the chances that we would be able to keep kids in the classroom without quarantine for, across the district? Like if we opened, I know that you're definitely not, I guess let me try to rephrase the question. My concern is that if we open, there's a high likelihood, especially with the high number of cases that we're seeing in our heat map, that there would be those disruptive switch flips that Dan was referring to earlier. And I want to just get your high level take on what you would expect would happen with the number of students based on the numbers,
Yeah. So, based on the number of new cases that we've been seeing on a daily basis over the past month and what I know about who those people are and how they're connected, I would highly anticipate that very quickly we would see a number of cases among students and staff, which would result in quarantine. It's hard to say exactly how many, of course, but just with the sheer number of people that are returning to the schools in the buildings between students and staff, it's just unlikely, probably impossible that they wouldn't be impacted very quickly, and that we would have to jump into action very quickly to identify contacts and to keep them out of the buildings.
I will say personally that it has taken me time to adjust to what Darcy just shared with us, right? To really think about what that means. I used the example from the high school, right? Thought about it because, we're educators by nature, right? We want kids in those buildings as soon as possible, learning, experiencing as much as they possibly can. But in the back of my head and in the heads of a lot of other education professionals that I work with here or that I talk to elsewhere, that scenario that Darcy just painted has weighed heavily on all of our minds. That probably, more than almost anything else, is responsible for how we decided to do professional development, for how much energy we put into preparing for serving kids who might be quarantined. That it wasn't a small decision to say, you know what, we're going to take school improvement and most of the other things we expend a ton of energy on in a given year and just put it on the shelf in anticipation for the scenario that Darcy's painting for us. So that point, that scenario she just made, that in answer to your question, that has weighed very heavily on my mind personally.
Yeah.
And
do you mind if oh, yes, please.
I would just add to that. I think if you look at the symptoms that are listed by the CDC for COVID-19, they overlap with all of the illnesses we see in the fall. So the common cold and all of those types of things. So even if we don't have positive cases, we're going to have kids who are symptomatic, and there's going to be recommendations for those kids to be quarantined at home. And depending, sometimes even if they have a negative test. So I think the possibility of having no one quarantined at home is very, very small.
Thank you. And to follow up on that, if it's okay, can you talk for myself and for everyone here and anybody listening, and tell us a little bit more about what contact tracing even looks like, and how the number of cases that are currently in Oak Creek as a municipality are handled by your office, and at what point would contact tracing become difficult, and what are the risks of that?
So every time that any
I don't know if you're on.
Thank you. Anytime that any Oak Creek resident is tested for COVID, those test results are reported to the health department. That's per state statute. So we get all of the positive and all of the negative tests. Anybody who tests positive, our goal is to reach out to them within 24 hours to make sure that they know that they've tested positive, and to make sure that they are isolating at home so that they're not spreading disease to others, and also to identify anyone who they've had contact with while they've been infectious. So for a person who has symptoms, their infectious period begins 48 hours before their symptoms started, which is really challenging. So if you can imagine coming back to school, a student develops symptoms on a Friday, for example, goes to get tested. If they were in school Wednesday and Thursday, all of those students would have been infectious, and they would have had no idea all of those that student would have been infectious, and many people would have been exposed, and because they didn't have symptoms, they wouldn't have known that. Similarly, we're seeing a lot of people who are asymptomatic and testing positive, and those people also can spread disease. And so with the person who's asymptomatic, it's very difficult to know exactly how long they've been infectious and who we might exactly have to quarantine. So when we reach out to that person who tested positive, we go through that whole period of when they were infectious. We talk through what they were doing, if they went to work, if they went to daycare or school or any kind of gathering, and do our best to identify at those places who is identified as a close contact. The criteria that we use for a close contact is anybody who was within 6 feet for a cumulative total of 15 minutes or more over the course of a day. And that's cumulative. So again, if you think into a school building, it could be 2 minutes here, 5 minutes there. But if over the course of a day, for example, 2 students were at their locker next to each other for a total of 15 minutes, that person would be a contact. So contact tracing is difficult in any circumstances, because then we have to gather all of their information, and then we have to in turn call all of those contacts and order them to quarantine or ask them to quarantine. But if we think about, again, in a school setting, in an elementary school, like Dan said, it's a little bit easier. Those students generally stay with their class. It's pretty easy for their teacher or the administrator to say where they've been. But when we get into a middle and high school setting, it becomes very quickly very difficult to quickly identify those contacts and then to make sure that they stay home so that if they become ill, they don't expose others. With the high level of cases that we've been seeing over the past month, our resources have been stretched very thin, and we're working 7 days a week, but it's hard for us to meet those deadlines that we set for ourselves as far as notifying positive cases and contacts. And if that number of cases continues to be high, which we don't have any indication that it won't be, if we return to in-person learning, it will jump even higher, and it will be very, very difficult for the health department to do that in a timely manner. Like I said, we're working 7 days a week. We're really doing our best, but we're limited by the number of staff that we have as well. So we would be relying heavily upon the schools to help with that and to probably do some of that notification of the students and staff.
And could you spell out for us what is the risk when contact tracing is no longer able to be done in a timely manner?
Sure. If we're not able to do that in a timely manner, sometimes people who test positive don't know it because sometimes the health department is the only entity who's calling a person to tell them that they've tested positive. So they may not be staying home. They may be out exposing others. But more importantly, if we're not able to identify those contacts and ask them to stay home, those people who have been exposed have a risk of developing the disease themselves. And so if they don't know they've been exposed, they're not staying home. And so each of those contacts, which for one positive case, we're seeing quite a few contacts at this point. They can all be out in the community or their workplace or, again, daycare, school setting, exposing others potentially if they're getting ill.
Thank you.
Do you have an idea of how many people the health department is currently having under quarantine and monitoring?
I would say it's probably over 400.
Okay, thank you.
And what? You hear a lot of people talk about false positives, people that enter. Do you see a lot of that? Is there any, either one of you guys can answer that. Is there any reason to that?
So I can start because we get this question a lot, and so it's something that we have consulted with the state on several times. And the feedback that we've gotten is that the vast majority of the tests are very reliable and that there are very few false positives. On the flip side, we know that it's easier to have a false negative because a specimen could have been, not quite in their nose far enough, or the test could not have been performed quite exactly as it should have been. So the rate of false negatives is far higher than the rate of a false positive. Labs are on a continual basis, multiple times throughout the day, checking the quality of their work and making sure that their results are accurate. So I do not have concerns about false positives, as a general, yeah.
Has there been any, go ahead.
I would just say I would echo that every test has its own false positive and false negative rate, but I think the tests we're using, the false positive rate is very, very low. But the false negative, I think, is a concern for all of us. The accuracy of the test as far as being a true negative depends not only on the way you do the test, so the person doing the test, but also when in the disease process you do the test. So you can get the test done too early in the process. So if you had an exposure, when is the right time to test that person to find out if they're positive? And that may even be up to five days or later after exposure is the right time to be tested. So if you were exposed and get tested 48 hours later and it's negative, that may be actually a false negative, and you may truly still have COVID-19. So I would agree. I think the testing, as far as accuracy for positives, I have less concerns about, but the false negative rate, I think, is a very real concern.
I was just wondering, has there been any daycares in the city shut down or summer camps shut down?
We have had both daycares and summer camps impacted.
Okay. The privately ones like Salvation Army or whatever?
Yeah, I can't speak to which ones they are, but we've had more than one of that type of childcare setting that's been impacted and has had to have quarantines of their staff and students.
Okay.
Dan, can I ask a logistics question?
Sure,
So
certainly.
if you said maybe about 500 of those 1,600 families said they might switch their response if we would start remotely. If they do that and the school district starts remotely and 6 weeks into it, we see the numbers are changing and we decide we're going to go back in person, they do not have the ability then at that point to say, I'm still not comfortable and I want to move to remote learning. If they've selected that, once school year starts, you're in that.
Correct. Like we're up against that place where we have tried to create a viable solution for as many people as humanly possible. But at some point, we're going to have to commit to staffing and license structures. So we, like that survey, for example, it technically closes tonight. I believe that's correct, Mr. Thielen, right?
Yeah.
I imagine
Noon
like,
on it, I thought.
there isn't a hard switch on it. Like I imagine people will anticipate the release of this video and it'll continue to trickle in. Plus people call us and talk to us. But at some point, we're going to follow up very shortly with the 500 or so folks who said, if you change course, we're interested in that. So we can circle in and solidly decide on staffing and licensure agreements. So your question is a good one. Like once people commit, like just say we were in a 4-week or a 6-week or a quarter-long interval, like the options read, if they wanted to come back to the face-to-face model, but we were in a virtual start, once we phased into phase 2 and people started coming back, that's where they'd be. We'd of course work with individuals, but we'd have to take a position on this at some point. So
okay, thank you.
And
Is there any? You go.
I was just going to say, and is there going to be, could you give everyone a sense of the timing for those that choose the semester, right? So there's the people that choose the semester virtual, at what point they would be asked to commit to either a second semester of virtual or to return back to school?
So with regards to that question, we would probably look and reach out to those families, probably, I'm guessing maybe November, to find out if they want to continue for second semester for the semester option, if they want to continue going. So we'd start reaching out and having those conversations with them then.
As an initial, right?
As
So
an initial.
we'd be communicating with that group of folks pretty frequently.
Correct.
So.
Yes.
So there wasn't any mention in here in the phases on the extracurricular things that happen outside of the classroom. Could you comment at all about that?
Sure. So as the rules stand today, right, and you understand the position we took over the summer, we wanted to provide as many opportunities for our kids as we could under the rules. And a lot of what we learned about what we'd experience in the fall, we learned from the July WIA sports season. So we would want to be able to do as much as we can allowable under those rules, right? So the WIA is much rumored to come out with more information tomorrow. Maybe they came out with it while we were talking. Maybe they'll wait another week, right? But whatever we're allowed to do, we're going to try as hard as we can to provide as many opportunities as we can for our kids. So if someone's phased virtual, but the WIA says we can go ahead and allow them to participate, that's what I would recommend that we do. Right. Of course, we'd coordinate with some of the fine folks in this room to make sure we could do it as safely as humanly possible, or as safely as we could, but we want to provide as much opportunity as we can. So does that answer your question?
Yeah, thank you. And so just so I understand, the motion that's on the table that Cheryl started, with the way the metrics are in this, we would be virtual to start the year, correct?
Yes.
And that would mean that the implementation of that would happen and continue for how long?
So as the motion on the floor currently stands, it's adopting what's been put forward in this report, which has that 6-week interval that, like I had talked about with Leah before. So we would know by week 4 if we were going to move into a hybrid setting by the 6th week or so of school. Right. So as it stands, but of course, like we learned on Monday, like if a motion wants to be withdrawn in a second and you want to modify or you want to go in another direction, I'm taking good notes on your motions tonight. So it's all on the table.
Okay, thank you.
I'm actually a little confused about the extracurricular piece of this, and maybe it's because I'm not a WIAA pro. I don't really know what the WIAA guidelines are. So for those of us that don't follow that organization, could you say a little bit more about what it is that you're proposing would be what we would move forward with? And could you also clarify what falls under WIAA's umbrella? Because when she says extracurriculars, I'm thinking like forensics and chess club and theater and all these things that are definitely not what I assume are under the umbrella of WIAA. But like I said, that is not my wheelhouse. So if you could
Sure.
help me out,
Let
that'd
me
be
jump
great.
in. Okay. So so if you want to be a WIAA school, right, which we are, you have to join that governing body. So our conference, the organizations we're a part of, if we're in competition, we're governed by our governing body's rules and bylaws, right? So as a WIAA member school, we have to comply. And WIAA extends beyond athletics. It's athletics and activities, right? So some of those examples that you give, like we're all under the umbrella of the athletics and activities code. So whether you're, so in my house, I was a forensics kid and a football kid, right? So both of those things are governed by that athletics and activity code that we approve once a year. It all fits under that umbrella. So if WIAA says like it's allowable WIAA school, we'd want to follow those WIAA rules. Like the July summer athletics and activities season, for example, that was under the umbrella of our membership in the WIAA. So, so say for example, like we're in open session 5 days a week, right? So a kid participating in an athletic or activity endeavor, right, might be present at school from 7:15 in the morning until whenever their activity wraps up and they finally get home, right? So in one of these hybrid settings, it might be a little different. Like you might be in school virtually for a period of time during the day, and then you'd have your 2-hour practice or event or activity that you'd come together for. Those you'd still have to follow the same health and safety guidelines we'd put forward. So if you show up for play practice, or if you come in for a running club or something like that, we'd work with Darcy, just like we did over the summer, to make sure we are grouping appropriately. So we opened some of our facilities for activities. Scott Holler met with Darcy a number of times to make sure what we were doing fit with recommendations they made. And Scott communicates with WIAA and reads all their latest updates to make sure what we're doing collaboratively fits in harmony with both what the health department says is best practice and what WIAA says is allowable as a member school. Make sense?
I just had no idea WIAA was over all of that. I didn't.
So we wouldn't work. So I wouldn't necessarily recommend that we would further restrict anything WIAA said was allowable, right? So, but we work with Darcy to make sure whatever we were doing aligned with best practice.
I think the best thing to do is follow Scott Holler's recommendation. He's going to follow the WIA rules and procedures, and he's our athletic director. He's covers all the extracurricular and all the sports. I appreciate his leadership, and I think we just continue going forward with that.
Scott and Darcy worked together throughout the summer. It worked really well. That's what I would expect to continue as we move into fall, winter, and spring. So.
Cool.
And then what about like special ed? How, if we went remotely as the motion is on the board, how would that affect them? Because I know they were impacted probably most significantly with our remote learning. So how could that, and then part of that was because of the governor's order to close schools. So barring closing schools, what can we do to help that population?
So I think I speak for the whole team and the community writ large. Like we're very concerned about being able to adequately, appropriately address the needs of all of our kids, right? Our students with special needs among them and in particular. So were we to end up in some sort of phased reopening, or were we to end up in the distance start that's laid out in this document here. My words are failing me a little bit to now. We definitely want to be able to provide extended learning opportunity, small group tutorial, at times IEP meetings on site if we could, social distancing like PPE, etc., face-to-face with those practices in place on site when we could. And I know that we had a special education family meeting scheduled for tonight, which Mrs. Katarik and Dr. Gennerman rescheduled specifically for a little bit later in the coming days, so we could talk about that with that group one-on-one and share it. And Bridget's here tonight, and I'd ask her to weigh in a little bit too and add to what I've preliminarily shared.
Yeah, thanks, Dan. Cheryl, you made a really good point that in the spring, when we did have the statewide order closing schools, it really tied our hands a little bit more than our current situation in order to offer a really full continuum of services to kids. So absent of a school closure by either a local health department or the state, we have the opportunity to really discuss and consider a fuller continuum of services for kids. So that would be an IEP team decision where the school staff, together with the family, is really considering the appropriate placement. And placement is not just like, is it in a virtual setting or a school setting, but that also contains the frequency, amount, and location of services. And so each team would consider what is best for that child given their disability-related needs and consider a broader continuum now than we could in the spring. We will still retain our right to provide kids with disabilities a free and appropriate public education. And even in this global pandemic, they still retain that entitlement to services. So the absence of the order, as you mentioned, does provide us more flexibility. And as a department, we're certainly going to consider how can we engage in those planning conversations in the IEP teams with families, and making sure that we ensure that we can, if needed, provide that in-person service to kids safely. So that safety piece will definitely have to be part of that planning conversation.
Okay, thank you.
But we have much more flexibility at this time, absence of that order.
All right. Thank you.
Yep. Another thing, thank you for bringing that up, Cheryl. I was going to ask about in-person therapies, but I think that covered it. And then my last thing I wanted to bring up that's on my must-mention list is, and we've heard a number of people at public comment express concern about children having access to meals, and it is my understanding that our district has not wavered in its commitment to continue our meal program throughout all of our all the days we possibly can. I know we did it well into the summer through our shutdown time per state order. We continued our meal program for many hundreds of kids, and I assume that we'll be continuing meal program no matter what the vote is here today.
So it's very clear to all of us that families depend on us for much more than just an education, right? I know that Andy and Taher have been thinking about this, like I said, contingency, worrying about it. We're in the preliminary stages of figuring out what this looks like, even at this late hour, but Andy's going to be able to share a little bit more.
You're not on, Andy. Mm-mm.
There we go.
There we go.
Sorry about that. Our food service that we provided during the school closure was under two plans. One was called the Summer Seamless option. That was the initial piece that was provided by DPI that allowed schools who didn't normally feed during the summer to just start providing food. We ended up moving to the summer food service program because we qualified for that. So again, that's a program run through DPI that allows you to feed over summer and follow the regulations. None of those options at this point in time are available for the fall. So for us to provide food service as it currently stands, we will have to find a way to determine who is coming to get food on an individual basis to determine whether they qualify for free or reduced lunch and or are a paid student. So in the spring, parent pulled up, said we have 3 kids. We just provided a pile of food that would have fed 3 kids and off they went. At this point in time, that is not an option for us. DPI has not provided a waiver for that. So for us to provide food, it would be who are the 3. We'd have to figure out who the 3 children are, and then how do we code them correctly inside of our software? It's not just a meal claim based on number of people that come.
I will say it's August 13th, right? And DPI has worked to make some of the waiver processes a lot more streamlined as of late. And we are not the only school district in Wisconsin who feeds people, right? And we are not the only school district in Wisconsin who would find these current restrictions burdensome, to say the least, in continuing to provide families with food. So I would say that this conversation shouldn't be over by any stretch of the imagination, and any ability that we had to lobby for changes to that, as Andy described it, we're going to fully execute. It just doesn't seem like something that is in the best interests of families. And if we couldn't change it, we'd figure out how to do what Andy was describing as best we possibly could. So this is not ideal, Leah.
To Dan's point, there are going to be some large school districts, we'll just name MPS and Madison and Green Bay, who are also going to be in the same boat. So they have some heavy lobbying that they are able to do at the state level, just given their size and the number of students that they are in charge of out of the collective 850,000 or so. So again, to Dad's point, it's not ideal, but there's going to be some collective voice to find a better way to do this. As we know, all three of those districts are moving to some sort of virtual model to start the year. And so they're going to be in direct need of something, a better way to do it than to figure out how do we determine which students are actually getting meals and which are not.
Anybody else? Okay.
I see with the criteria. I don't think you're on. Hey Dan, while they're trying to fix Mark's thing, so the motion on the
Now
floor.
we got it?
Yeah, hang on,
Yep.
Mark. So the motion on
Now
the
we got
floor
it?
that I seconded, would we still go with September 1st for the people that want to go face to face, and then the virtual? Or are we waiting 6 weeks from today to see if our numbers come down?
It would be 6 weeks from the first day of school.
So it'd be virtual for the first 6 weeks.
That's right, under the current motion as it stands.
Okay. So then
Right,
I'm going to
which we
rescind
have-
my second then.
Right, which we haven't voted on yet. So
Okay.
like we can come back around this in a minute. I
I'm
know
going to
Mark's
rescind my
got a bunch
second
of
if I have
questions.
to.
Yeah.
All right. What I started to say is we've got all the criteria for going into classes, but how do we regulate or monitor when we're going to go back out of classes if it comes to that? At what point? I mean, or is it a 2-week period or a 4 or 6 week period where you have 6, 8, 10, 12, and then you're out after the 6-week period, or do we look at taking kids back out of school if it's 5.6 or 6? How are we working that? Because everything deals with putting them into class, but nothing with getting
How do we
back
get
out
them
of
out?
class.
Yep, 100%. So what I would recommend we do is we build a scorecard, right, with these criteria, and we coordinate with the data release on Thursday to populate the scorecard every Friday. So every week we update our scorecard and we make it clear and visible and publish it for people. And we have the 2 or 3 top criteria, the ones that have the ands by them. Those are the ones that are absolutely critical. And then we have the supporting criteria below that we'd apply to the scorecard as well. So I'd say every week we should be able to update our scorecard and determine whether or not we're on a trajectory that leads to switching phases or not. So even though it reads as a 6 weeks interval as it currently stands, I'd be recommending we monitor this week to week and share the results.
Well, if that's the case, being that we're doing every school individually, this really turns into a logistical mess after a while.
I mean, it's a district scorecard because it's a community scorecard.
All right.
Because I don't have like Carrollton or Cedar Hills numbers. It would be applied to the whole. We're using the city's number for criteria 1 and 2.
All right.
Okay.
So then it's a broad application of
Yes, sir.
when they go up. All right.
But can I just ask to Mark's question? So in order to go back in, you had 2 weeks of 2 weeks dropping down and then 2 weeks to plan. So if a scorecard comes out on a Friday and it is below where we had been, is it back to remote as of the next Monday, or is it 2 weeks down, 2 weeks down, and 2 weeks to transition the other way?
It's a good question. Like I said, it's
That's kind of what I was
What
getting
you're
at.
trying to ask? Yeah.
Yep. No, I understand what you're trying to ask. And like I said before, like the logistics of flipping the light switch, like that's the challenge, right? So you need an extended period of time where our scorecard for 2 weeks in a row shows this trend. And then as I wrote in the recommendation here, which I'll admit reads rather awkwardly, right? So trending down over at least 2 consecutive 2-week periods of time. So if you're thinking about it logistically, here's your scorecard, downward trend. Here's your scorecard, downward trend. That's 2 weeks. We get another 2 weeks. We know where we're going. And then by week 6, we're back into school because it continues downward. And this is, I'll note, the exact same interval that they're using in South Milwaukee.
He's asking for the other way.
If it's going up,
Right.
Yeah.
From a bad scorecard on Friday to virtual again on Monday, or do we say if it trends up for 4 weeks, we have.
Jane is muted. I don't know.
Oh, I'm sorry.
I can hear her, okay.
Yeah.
So his question was, we understand how to
oh, okay.
open
No,
up
I'm
more.
sorry. I
The
wasn't.
other way,
I
how
get
do
it.
we
I get it.
decide when we close? And is it the same
So-
6 weeks?
I understand now. Like the warm up to it, right? Like the warm up to it is dependent on our logistic ability to figure out a warm up. But this is more aligned with like when does it trip to close, right? And that aligns more with a closure order, right? So if we're in phase 2 and things shift like significantly and put us over a line, that would feel more like a switch, right? Because now we're in a red area that would trigger these criteria that could potentially close us, right? So if we're in phase 2 and we trip back into the high rate and our burden goes over 5%, now we're in a position where we'd have to go back. And that would be a dramatic shift.
That could happen.
That's why I said
instantly.
logistical nightmare.
I just wasn't understanding you, Mark. Now I get it. I'm slow tonight. So
It's been a long day.
Yeah, and so if I were to just ask another way, turning on takes a while. Moving back into the building takes a while. Moving out of the building is done in a very quick fashion because numbers would indicate that coming back to school would be not a good place for us to be.
similar to the risk-based criteria that could result in a closure, which would be quick and swift, right? Maybe even the second or third day of school, given what things look like right now.
Could that hypothetically be done classroom by classroom at all levels or elementary level? I'm just thinking of like you have one student who gets sick. He's around all of the students in that classroom. Would that classroom then be expected to go home quarantine, not necessarily impacting all of the school, but those students in that classroom go home quarantine and do virtual?
So you're asking about a hypothetical situation where an elementary classroom has a symptomatic student, right? And the rest of the room ends up in quarantine if we're in a face-to-face setting.
Correct.
So that elementary section, and Darcy, correct me if I'm wrong, and anyone else who wants to weigh in, that group, that entire group, instructor included, could be quarantined based on how the quarantine rules currently stand right now. Correct?
Yes.
Yes.
If the rest of the city numbers are still below what we
They're
want it
still
to be,
low,
if it's
right.
just that one classroom,
Right.
we wouldn't have to flip off the entire, oh, that didn't come out right. We
Flip
would
'em
have
off.
we wouldn't have to flip the switch on the entire district, just that one classroom, as long as the city numbers still stayed where they
So
needed to be.
to the logistical point being made by some others, this is a logistical nightmare.
Yeah.
Make no mistake. Contact tracing is, quarantining is, right? Like applying these criteria, this is the biggest logistical challenge we have ever faced, right? Like that is very, very apparent to us. But also, like, if we want to get kids back into rooms, if we want to figure out how to learn, right? If we want to figure out how to provide additional instruction while kids are quarantined, and they will be, as they have been already throughout the summer, right? We have to face the logistical challenge. There's no avoiding it. It simply is, you know?
Right.
The only other option really is saying, then you send everyone back face to face. And if lots of people get sick, too bad, keep teaching face to face, which obviously is not something we want to do. This,
or would
although,
even be allowed.
right. And this, although could be lots of back and forth, is possibly what would need to happen in order to get kids even some face to face.
I guess you could consider this preemptive in some ways.
I've got another question too. I don't know if I heard it correctly or not, but with regards to the remote learning, are the kids going to have access to it only at the time when the teacher is doing it, or can they access it any time of day? I missed that before.
I'll ask Mr. Thielen to make that point again.
Yes, so they will have time. So there'll be time for synchronous learning, means actual instruction by the teacher. It starts out with few hours at the elementary school, moves to more hours as you get to the secondary level. Then there's what's called asynchronous learning. So that's time outside of that direct instruction, where they'll have an opportunity to do work, get extra help, maybe work on a project, those types of things. So they'll have a blend of both.
One of the biggest complaints we heard from spring was that there wasn't enough synchronous learning. Like people wanted more synchronous learning, but there's challenges too for people who can't get in there to watch it for whatever reason.
Right.
So Dan's point earlier was we now have the technology and the tech support to record those and share them later, but there's still going to be the asynchronous elements, which we had in spring, except improved. So,
well, the reason I asked is because with the family situations, if I can't be there with my son or daughter to do the synchronous, can I access it at 6:30 at night when I get home from work? Thereby, you don't have to, worry about the kids having to do it while you're not home or whatever, or having a grandma and grandpa try to get it done, or try to get it done at daycare if they're at daycare, or whatever the case may be.
Right.
That's my
and not to get ahead of ourselves either, but like we are looking at opportunities for expanded school days out, or like Bridget talked about with our students with special needs, that doesn't just stop with our students with special needs. Like if you need tutorial instruction, like we'll have some flexibility to do that. I'm sorry, Dan, go ahead.
No, I just also wanted to mention too, to your point, I mean, you can do it in the evening, it can be on the weekend, so there's a lot of flexibility there.
And then I guess as a follow-up, people that do choose to have their kids remotely educated, once they sign up for that, they're in it for a semester or quarter, whatever.
Right. So we had committed to it initially for a year, but we'd heard a lot from our community about that just being too much. Like there's a lot of desire, as you heard through public comment and everyone else, to get back to normal as quick as possible. So we changed it to a semester-long commitment with the opportunity to renew. So 100% virtual folks are committing to a semester at a crack.
All right, and then to the opposite side of the question, if I have my student in school and I decide I want to put them in remote, do I have to wait till the end of the quarter or end of semester?
So we're trying to determine section counts and staffing. Like it gets very hard to let people like switch frequently between models. Like if someone had extraordinary circumstances, like we always do, we try to work with people. But at some point, like we're setting class sizes, we're finalizing staff. That's why we're trying to get people to commit to one way or the other. But like we always work with people, we'll work with people. So.
Okay, and then one more, and this goes to the high school thing, but because I know there's a lot of kids that work after school and whatnot. Are we going to make it so kids can take certain classes at school and then remote some other ones if they have scheduling conflicts?
Can you repeat that one more time?
If you have a child in high school and say the kid's got a after school job, but he has to start at, or he can start at 1:30. Can he or she take classes at school and then take some of those classes remote and leave school early? Is that going to be an option too, or no?
Are you talking like if they went to the 100% virtual option, or if you're talking that they take
No. I'm saying if they were in school and they wanted to leave school early, like at 1 o'clock, and they still had 2 classes left, because they take 2 classes out of the 5 classes they had remotely and still be in school for the beginning part of the day.
like if we're in phase 2.
Oh, we're in phase 2. So if we're moving like into like a hybrid model where part of the time they'd be in school, part of the time they'd be doing async. Yeah.
I just asked if they could choose to pick a class that they didn't want to take at school and take it remote. Or will they be allowed to do that? That was my question.
No, not unless, only if they were going to a work site or something like that, but no, they wouldn't be allowed to do that.
All right.
Dan, I've had a number of people say to me as a school board member, it's your responsibility to make sure the kids are safe and healthy and well educated. And I shouldn't be worried about what happens at home or how parents figure things out. And as just a human being in person, I have struggled with that. So it does weigh very heavily on me, the single parent with 4 elementary school kids that says, I don't have daycare, I have to go to work, or I can't pay bills. I know it's something that, depending on what we go with, you said may expand. Can you speak at all to, you mentioning schools, days out, programming, what options we may have for families that if we would go to a virtual option will really struggle with getting parents to work and having young kids who are home?
We'd want to explore all the options available to us. Like, I am absolutely not immune to like what a hardship any decision we make tonight is going to be. Like the phone calls all of us have had, the people we know in the community, the experience we've had with folks who live here and struggle, right? Like you can't do these jobs and not know like all these different, unique, difficult stories, right? So while I couldn't tell you exactly tonight what school days out expansion may look like, what's allowable, what we could get approved, we'd work as hard as we could to figure that out. That's not a complete answer, but it's the best one I've got for you tonight.
It's on the radar, and I guess that's what I need to know.
Yep.
So we have a motion on the table. Does anybody else want to say? Cheryl did make a motion. Darren seconded. There's discussion. Anybody else?
Well, I had just a thought here, and I asked Dan during our break if we had to follow all the criteria, phase 1, 2, and 3, to reopen the classrooms, and I asked if we could single out one phase rather than adhering to all 3. And based on that, I'd suggest myself that phase 2, the criterion phase 2, kind of splits the criteria up the middle. It addresses middle of the road for getting the kids back in school. For as far as the levels go, you still adhere to the 5%. Deals with the in class and the remote education part of it, but I'd like to go with the motion number 2 in conjunction with that, and maybe switch to an 8-week cycle. And the reasoning for that, I think, for myself, it makes it easy for families to plan a little bit better. Makes it easier for teachers to plan lessons a little bit easier rather than on a 6-week schedule. You'd have an 8-week schedule. Take some of the logistics, I think, nightmare out of it. And I kind of thought just a modified thing of those 2 would maybe fit everything a little bit better. Just a suggestion.
So option B doesn't address the high levels.
But the thing is, though, if you go to the phase 2, the high level becomes a moot point because you're already eliminating that. You're going past the high level and going right to the moderately high level. You don't deal with the high. High level's a moot point because you're already past that.
I'm sorry, but
I
I'm
don't
really
understand.
I don't understand.
Because we're at 9.
All right. So say if 9's a high level, okay, and that's in your first phase. All right. In the second phase, you're not dealing with the high level. It's got to get down to moderately high before you go in. Whereas, but then I'm saying take taking phase 3 out of it as well. You split the middle, just use phase 2 for your model to get back in school and forget about 1 and 3.
But Mark, would you
What
start the year? I'm sorry.
No, you're
Would,
fine.
would you start the year remotely?
Pardon me?
So we're at 9.56 or something
Right.
like that. Would you start the year remotely?
Well, you start the remote no matter what, because
Okay, so I
it's
just want to make sure I get it. So you're starting, and
That's
then you're
phase
going to
one.
wait. That's so yeah. So then you want to wait 8 weeks to go, and then for phase 2.
So you were
I'm
suggesting
getting
come
with
with
backfeed on it.
Mark, I
Sorry,
think
keep
what,
talking at once.
correct me if I'm wrong, you're saying we're already in phase 1 because of the numbers.
Right.
So the first phase that we're really,
It's a moot point.
the first phase you're really looking at is phase 2 is the one that we
Right.
could enter because we're already high in our metrics.
Right. Right.
And you're proposing 8 weeks of remote learning and then reviewing the number at week 8 to see where we fall.
Well, I'm looking at it this way more, I guess, than waiting till starting school. I think we should be looking at numbers now because they're starting to go down already now. So, I mean, that plays into the starting point of when you get back in school as well. And I guess for a starting point, you take the 2 weeks and 2 weeks, not 8 weeks. Once you're in the classroom, then it's an 8-week window. You know, you're 2 weeks and 2 weeks to get in, and we should start the 2 weeks by looking at the trends now instead of when you're starting school, because then you wouldn't have maybe hardly any time that you'd be virtual. You'd be almost ready to go by the time school starts.
So I think if I understand correctly and trying to rephrase, if once we enter phase 2, we would be in phase 2 for 8 weeks before we would decide to move to phase 3, regardless of where the numbers are. I'm just trying to make sure we understand.
I'm saying the monitoring process would be a 8-week interval instead of a 6. But you wouldn't actually go into phase 3. You could, depending on what the numbers do, but nobody's going to know. That's like, I don't have a crystal ball here. I don't know what's going to happen. Neither does anyone else in this room.
Right.
And I'm just trying to get to a point where we're not switching back and forth every 5 or 6 weeks and having to go to school for 4 weeks, and then you're back out of school for 6 weeks, and then you're back in school for 4 weeks. And like I said, you know, by the time you deal with all of the school support staff, all the bus company issues, all of the lunch issues that you're going to run into, then you get with the poor teachers. You know, how can you teach a class when you're going 3 or 4 weeks virtual, and all of a sudden, oh, we're going to go back to school, and you're in school for 4 or 5 weeks, and oh, we're going back out of school again. I mean, what kind of an education are the kids going to get? Because they're going to be flopping every which direction from Sunday.
I think that I think I'm starting to understand what you're trying to say, but I'm not sure that your solution of extending the time that we wait before we switch phases to 8 weeks really addresses the fact that we would still have to switch if we ended up with cases in the classroom. Right? So,
well,
I guess I'm not, like, I hear what you're saying on slowing down the phasing, but we don't have the phasing is there to help with the school planning for coming back in. It's not going to stop the potential of having to come back out, and it's gonna come back out whenever it comes back out. We're not going to be able to tell it to wait for 8 weeks, you know. So I get what you're saying, but I'm not sure that it factors in the continued likelihood of intermittent quarantines, and assuming that there aren't any intermittent quarantines,
right,
then the 8 weeks won't be a flip-flop thing, or the 6 weeks won't be a flip-flop thing. It'll be a smooth, slow transition back to school.
Well, that I guess goes back to my comment. Nobody in this room knows it's going to happen 8 weeks from now. So, I mean, or 6 weeks from now, you know, maybe we'll be at 2% in 6 weeks. Nobody knows that. You know,
yeah,
we might be at 14% in 2 weeks. Nobody knows that either.
Mark, I do think we should put the scorecard together and start monitoring in earnest, like as soon as humanly possible. Like, I wasn't proposing that we wait weeks before we like populate the scorecard, start tabulating this. Like, I'd love to see this drop like a stone and get us back in as soon as humanly possible. And if it was trending downward rapidly, right, we'd be able to apply that criteria and bring people in phase 2 as quick as we possibly could. I mean, Darcy's nodding her head yes. Like, everybody wants to get these kids back ASAP. So,
Well, so
But
maybe
we've been
then.
charting daily rates every day for weeks.
I mean, I would love to start.
To, if possible. Were you saying something? I'm sorry.
Andy,
Sorry,
for
I was
Dan's
just saying
point,
we've been charting daily rates for weeks of the Oak Creek's burden, and then by the age band, and trying to monitor that for high, moderate, and low, so that we can kind of just project out over a period of time. And so, like, every time the numbers come out, I'm like, geez, if we can just get only 14 cases in the next 5 days, we're going to make it to moderate high. And so we've been charting that for 5-6 weeks.
a couple weeks ago when we first got the first tables and we were trying to drill down like to the school level, like we were talking about earlier tonight, like Andy with his spreadsheets back in his office with his abacus, like started trying to drill back into this to figure that out. Cause like we want that scorecard that allows us to turn that knob like when we can, right? So to Andy's point, it's not a lot of work to take our data tables from when they published the first page that we started looking at, and we started hearing terms like burden and rate and all those pieces, to putting that into a scorecard that we're looking at like on the regular. Like, we probably have a scorecard 7 to 10 days, like maybe sooner, you know? So between Darcy's data that's populated with the city every 3 days a week, updated, and the Thursday update, plus Andy's independent tracking data, like, we start the scorecard right away. You know, for the purposes of planning and to sum this up, like I said, we would know by the 4th week of school if we were coming back at the end of the 6th week of school, if you stuck to this timeline.
Could you start counting that
today?
Could you start counting that today so that we could take, if from today to school start, things were trending down, could those be 2 of the 4 weeks
That's
in
what
the
I
initial downward trend?
Yeah, that's what I was asking earlier.
You're asking, is that logistically possible? So
Yeah.
that condenses the. I'm thinking out loud. Go ahead, Andy.
The key point, we can put that metric and check it every day. The key point is we need the 2-week turnaround from the time we decide to transition from remote to in-person. So from our standpoint, any time frame other than 2 weeks we could do. So if you want to do 2 weeks in a day, now that means we're checking every day and we're flipping again in 2 weeks. So we could meet that.
No.
But I'm just saying, if there's
we still want to see a progressive trend.
Like, no,
So
we can't
the
read
point is
that.
we still need to see a downward trend. So if Tuesday transitions down from Monday, I would say that that's not a reasonable assumption that we're in a downward trend. So we still would want to put in some sort of cycle, but again, we still need to tack that 2 weeks on at the end. But can the cycle be modified from 2 to 4 to 6 to 8?
I don't know that that's
And I'm
what
okay
Dan's
with,
asking.
no, I'm okay with the cycle. I'm just saying, rather than starting the cycle on the first day of school, can we start the cycle now? So our 6 weeks could be 4 weeks into school, but 6 weeks from today, rather than 6 weeks from the start of school. Today, we start downtrending for the next 4 weeks. Then at 2 weeks into school, we say in 2 more weeks in person. So don't start tracking now, and if we see 4 weeks, 2 weeks down, after that, we'll go, rather than waiting to start that tracking on the first day of school.
Yeah.
That was my idea as well.
Clarifying
That's good for.
Okay.
You and I just
Thank you.
I think
Okay, but,
way to take
I do
credit,
want us
Mark.
to talk about something.
Can we please just take a second for me to get this memorialized? Okay, like I'm trying to get this straight in terms of emotion. Okay, so we would be. I'm thinking about how this would be phrased and written.
So we'd still be meeting the 2 consecutive weeks of 2 weeks, but we would start tracking tomorrow, August 14th.
Your
So our blue box,
proposal
Dan,
for the
still
timing is
exists.
the same. We just start tracking now.
Okay.
This blue box that you have still exists. It's that tracking would start tomorrow rather than September 1, first day of school.
Okay.
Sorry, I didn't mean to make it more difficult.
No, it's a very good point, and I'm glad that the two of you flushed it out, and now you've helped me understand it. I'm just trying to get it like properly written. So
And
track.
Darcy,
Then
do you
drop
see
phase
any
one.
problems with that at all from a health department perspective, or Dr. Jarrett?
No, I don't think there's any concern with that. I would want to, I mean, I think once we move into the second phase and we're hybrid, I think it's going to be really important to see what happens when we start bringing people back together. So I'd be hesitant to rush that phase. But I think, right now, we're obviously not in school. If we're going to start remotely, that's not going to impact that, that point. So I think that there's no problem.
So, okay, so let me say this, so I'm amending the blue box, and to sum up, it would say we would decide by the second week of school if we will move to hybrid as of the fourth week of school, because we'd begin tracking now.
Yeah, and I don't even know that we're still going to be tracking the 4 weeks and then 2 weeks to prepare for it. It's
Got it.
just, we're starting
Got
that
it.
now.
So it doesn't even really alter the language of the top motion. All it
No,
does
it
is
doesn't.
we populate the scorecard ASAP, start
Right.
tracking the data. Now
You
I
just
know. Though that was really simple. I'm sorry it
Yeah,
took me that long to
yeah.
get done.
So all you
And
need
I
to do,
completely
Dan, is strike the sentence that we would decide by the fourth week of school to move hybrid to the sixth week of school. It's just an unnecessary sentence. You're still following the guide. I mean, I think that whole thing could be rewritten to just say 4 weeks instead of 2 consecutive 2 weeks. I don't quite get why it's 2 consecutive 2 weeks. It could just say 4 weeks. So
4
I would
consecutive weeks.
4 consecutive weeks.
Mhm.
I think that would be my recommendation for an edit to this and then striking that sentence over trying to pick what day we start. I mean, as of your first ability to do it, which, maybe that's tomorrow, maybe it's Monday.
Right.
I mean, whatever. Yeah, Andy?
I just want to add a point of clarification. So the at least 2 consecutive 2-week time periods, that just lines up with the burden rate of 14 days. So the 100 per 100,000 over 14 days
Correct.
just allows you to bookend 2 weeks or 2 14-day periods. I get it, it's clunky, but it was just trying to
why
put
it's
it into
written
the
that way.
chunks in the way that data is actually presented for,
Yeah.
as Darcy mentioned, communities to compare.
And I'm realistic that there was a spike after the 4th of July. There may be another spike after Labor Day. But if for whatever reason there's not, and people
Wear their
do
mask.
this well,
Mm-hmm.
then,
Mm-hmm.
fingers crossed.
Right.
Okay,
Yeah.
so one more time. So because of the 14-day alignment and the release of data, I'm leaving the blue box alone, but I'm striking that last italicized sentence. And we begin the scorecard. We begin it tomorrow. It might take a little longer to put it together, but our data draw starts tomorrow, which is a Friday, which lines up with the data drop that the city has and when they update those burden charts and stuff. So it actually works out very well. So we start running the clock tomorrow. Okay, I got it. Because the one thing I want to do is strike anything from this report that doesn't help our families understand the decisions you all are making tonight, because I'm linking this to whatever summary I finish by midnight tonight that goes out. So the modification I'll make is I will use strike through on that so I can share this report.
What's the max weeks? Is it 4 weeks or 6?
6.
What?
You'd still be 4 weeks into school, Frank, instead of 6
so
weeks
4
into
weeks.
school.
Okay, because I'll be honest, this is exactly what I wrote. I just want.
It was Frank's idea too.
Well, no, I'm just telling you exactly what I wrote was. I would recommend that we would have check pulse every 2 weeks starting tomorrow. With basically to start virtually with a minimum of 30 days, which is 4 weeks. And so 4 weeks, every 2 weeks, we check the data, and basically that's our check pulse starting tomorrow.
Mm-hmm.
And so that, because to me, the feedback I got was the parents want to make the decision if they want to continue going virtually after that, say if the numbers go below 5 and we start phase 2. And let parents make the decision. If they want to continue going virtually and that's the best thing for the family, then let them do it. But if they want their kids to go back in person, then let them do it. Let the parents make that decision. What's best for them. And I think this is, I agree with this checkbook. I agree with that.
No,
You're
but
not gonna
Frank,
work like
you're
that,
saying that if we go face to face, parents can opt to still keep their kids virtual, and that's not what we're saying. They're saying if you
No.
pick the program, if we go back face to face, coming face to face, that's
Yeah.
what we.
Yeah, I'm fine with that. I just want to make that clear. So.
What part are you talking about that, what part were you talking about?
I like the part with the check pulse every 2 weeks starting tomorrow.
Right, but what was the part that you were just saying where the parents would be making the decision?
I just thought if there's a way that we could continue doing the remote part of it, like, because you have
Well, we
kids
do.
with,
Those kids are going to enroll in the OC virtual.
Correct.
That is unaffected, right? Regardless of these timelines and
then
stuff.
that's all I
Like if
want to know.
you sign up for
That's
OC
good.
virtual,
Good.
and after we send out our
Yep.
thing on Friday or Monday, that really solidifies our numbers. Like those people, like I said, I'm trying to draft this message, and I said, well, clear enough. If you chose the 100% virtual option, you're unaffected unless you would like to choose the face-to-face option. Now phase to start in a remote learning format. That's exactly how I would lay it out.
That's
So,
perfect.
and then we will know that in short order because we already have that finite list of those 508 or so people who indicated that they might want to switch back if we made the change you all are talking about. So that would commence as soon as we could logistically manage it, Monday at the latest. Okay.
And,
got it.
And Dan, if you wanted, you could change that last sentence to just say tracking would start tomorrow.
Yep.
Tomorrow. Yep.
Yep. I'll update that before we share it tonight.
So is it fair to say our target date is like October 1st to bring them face to face? Or would you push that to the
I don't know if I would, Darren. I don't know if I would.
Depends on the numbers.
Depends on the numbers, Darren.
If we're in a downward trend, I'm saying. If we're in downward trend under 5, we're pushing right now because we're at 9 now.
Yep.
So if we're down by the 1st of September, hypothetically, to say 7, then by the middle of September, we're down to 3.
We start
by October 1st, we're coming back.
We start the data table now.
Yep.
Right. The soonest we could be back if we saw a sustained downward trend
is about October 1st. I think what Darren meant to say
around
is
there.
The earliest we could be back is October 1st. We don't know where we're trending yet, but the earliest we could be back.
Yeah, which is 2 weeks earlier than I had anticipated under this model.
Yep. So it's like a target. The target date is October 1st if we go starting tomorrow.
If the best happens.
Can't hear you.
I want to watch our term on the target date. The earliest we could return is our October 1st, not necessarily a target date. Our target date would be determined by the data.
Right, I understand that. No, I understand the downward trend. I totally understand that
earliest
part.
date we could be back, not necessarily a target date.
Okay.
And to clarify, what we're talking about here is that the positive test rate no longer exceeds 5% for 4 weeks. So based on the scenario you just posed, Darren, where you said sometime in the middle of September, we get to 3, we're not opening October 1st. We're opening after it's been below 5 for 4 weeks.
And Darcy, these lines, they like, if we were watching this continue to fall, it takes as much time generally to go down as it does to go up, right?
Probably. I think we might go up a little bit faster than we come down, if anything.
Okay.
But
Darren's scenario is a hopeful scenario. That's fair.
It is a hopeful scenario.
Okay. I know. We
all do.
So does all this discussion we just had, does that change anything on the motion?
Yes, it does. You're going to have to rescind your motion. Darren's going to have to rescind his second. And then please help me make sure we do this correctly. But I believe someone will then have to motion for item number 1, second, and vote. And the only modification I make is a material modification to the actual plan itself, which starts the scorecard tomorrow.
Why do we have to redo option
Dan,
1?
motion 1 was Motion one was what Cheryl put in.
Oh, I'm
and Darren
sorry.
seconded.
I'm sorry. See, that's why I asked for help. So good.
We haven't changed
No,
anything.
motion one is what was.
You're right. I'm sorry.
No.
You're right. You're totally right. Yep. Thank you. Yep.
Okay.
We're taking our time.
Okay.
All right. The only change is like I'm modifying the body of the report to start data tracking now. Right. Mhm. And I don't even think it says anywhere in here that we would start tracking data on
No,
the first day
but
of
it just
school.
says that we would decide by the 4th week.
So we're just removing a single sentence from the report, and we know operationally we begin data tracking now.
Right.
I get it. Okay.
But I do think that your communication to the community should very clearly state that we are starting, like that what we just decided, or if we decide this, that what we have decided are starting to track data now, and the soonest that we can return back face to face, that it's a 6-week cycle. And that, I hate to say it, but I think it needs a table. It says like, this is what we're kind of agreeing on. 2 weeks, we have to be below here. 2 weeks, same.
Or an example, say it was this for 2 weeks, say it was this for 2 weeks, by this date we would get to here,
Because I'm telling you, this is not going to go over very smoothly.
No. May I add one point to that, Leah?
Yeah.
It's important to note that first piece is 6 weeks. It's the 4-week tracking and 2-week to return, but then it rotates to 2-week cycles. None of this is based on the motion, but then it becomes 2-week cycles because we're reviewing in those 2-week chunks. So 6 weeks is that initial period, and then it's followed up by every 2 weeks as being reviewed and moving forward in that fashion. So it's not 6 weeks and then in 6 weeks we review again, or
right.
So
But why
6
is it
weeks
2 weeks?
because we had to have those 2-week trends.
You gotta add all that, Cheryl.
Those 2-week
Right,
trends.
but
have to
wouldn't
be
you just
met.
be able to pull a week from the week before?
You would. That's why.
Yes.
Then it's every week.
No, if we miss 4 weeks, because we still always need that 2 weeks of turnaround time.
Well, right, but I don't get it. If we would always be 2 weeks away that we would flip, but it wouldn't
No,
be
I
2
think
weeks before
maybe
you
you're-
could
I think
decide
maybe
again.
it becomes a week cycle after that.
It's a week cycle with a 2-week head
Because we're always
time.
backing up to just the
Because you're
next week.
always backing up. So you got to check every week, and you'll always be checking for what will happen in 2 weeks.
Yes. No, that is correct.
Yeah.
So 6 weeks is that initial period, and then it's a week. Then it's kind of
And then
weekly.
it's by the week with a 2-week head time.
Right.
Yeah. Sorry. That was my
None of
idea.
that affects the motion, though, Dan.
So just when me and Andy finish this document tonight. So.
It's just how we're tracking it. Yes. Yep.
Okay. All right.
I can't hear you. Are you on? No, you're not.
I don't think Cheryl needs to do anything different.
Right.
The motion
Call a
was,
vote, right?
we just vote.
Okay. Any other discussion?
Oh, boy.
Roll call. Jane,
Yes.
Mark,
Yes.
Cheryl.
I want to say something first. I'm angry at because we had no input from the federal government or our state. We love local control, but we still need criteria. Many dropped the ball, but I want to thank our health department and our peds medical advisor for their support and teamwork in this hospital project. Thanks also to our administration team, along with a few teaching staff, hard work and many sleepless nights on working on this since we closed in March. I want it clear that this process was not a result of grading or advocacy groups. This has been in development for some time in fashion since at least early summer. Science and data are driving my decision, and for that reason, I am voting yes.
Well said, Cheryl.
Nicely, Cheryl.
What's your vote? I'm sorry.
I
didn't hear.
said yes.
Okay, I didn't hear you. Darren?
And as Cheryl said and Dan said with this big old stack, let me pull your little stack, Dan, here. this right here, the folks that want face-to-face, we understand what you want, for yourself and your family. Like Cheryl just said it, she said it perfectly. And we got to go by the data, the studies, and Darcy and everyone else. I stand behind that. So, yes.
Amy?
Every effort has been put forth by this administration to get our students back into the schools. I mean, this is since March. We've been working on this, and it's been our goal. It's been the administration's goal, and this administration has worked so hard. I just can't thank them enough. I thank Darcy and Dr. Jareb for their help. And we all want normalcy back in our lives. And unfortunately, it's not there yet. Why am I on speaker? That's so weird. But yeah, so what? Okay, sorry. So I just wanted to say, we all want normalcy back in our lives. The sooner we can get our students back in the school, the better. But for now, the safest way for us to do it is with this virtual learning. So my vote is yes.
Yeah, yes. And thank you to the administration. And I just can't believe how much work this has all been. It's been the most harrowing month of people coming up with as many creative decisions. And I certainly want to see the kids back in the school terribly, but I hope the community recognizes that, we're all responsible for creating a safe environment for their return, and that we can come together and change the conversation in the community so we can all do better to bring these case numbers down so that we can get these kids back in.
Yes. Mm-hmm.
I'd like to, just say a couple words. First of all,
You're muted.
Oh, I'm sorry.
Mm-hmm.
Thank you. Okay, there you go. How's that? Better? Okay. So I'd like to discuss a couple things. I just want to make sure that, and to Dan and Bridget and Ted, I'm just talking. Yeah. I like to discuss about special ed to Bridget, Dan, and Ted to connect with agree with Cheryl's comments, to, special ed committee to create a plan, which was obviously they were supposed to be today, which we talked about, which was postponed, but really to discuss and get feedback on how and why to make a better experience for our learners. Even a couple hours of social distancing in a class a day would go a long way. Can we utilize the aides to be part of this plan? I know we have to meet IEP minutes per year, but which is a law now. But if we can to connect with them, that would be great. Sports and clubs, I know we talked about it, but I'd like to continue seeing sports and clubs to continue. I know we discussed it, and I continue to recommend that we follow Athletic Director Scott Holler's recommendations, which will update us to the board, especially what the WIA recommends. Thank you, Scott, for your leadership on this. Finally, I'd like to say thank you to each board member. Leah, Amy, Darren, Cheryl, Mark, and Jane. Couldn't be proud of every one of you. All of you did hard work, time, and dedication to our learners, professional, and support staff, and to the community of Oak Creek Franklin. We are doing the best possible way to try to keep a safe and quality education. I realize that families were frustrated that the district took a long time to make a decision, but in doing so, I feel like we're making the right decision tonight. Personally, I'm a father, and trust me, I want my kids to go to school because I haven't been to school in 37 years. I'm old. I don't know every question, right? When my daughter comes and asks me a math question, I have no idea what it is. Trust me. But I do have a sense of responsibility as a father, as a community lender, and obviously a board member to make sure that our community is safe. Finally, I'd like to say a huge thank you to Dan, the principals, the rest of the administration team, and all your hard work and guidance. It's not an easy decision for all of us. However, I feel together we will get through this. So thank you, and I vote yes. So. Thank you. So do we have a motion to adjourn?
Niglia moves to adjourn.
Dykoff seconds.
It's, any discussion?
Who turned off the air conditioning?
Amen. Okay, a roll call. Jane.
Yes.
Mark. Huh?
Mark's a yes, I'll vote for him.
No, I vote no. I'm gonna
Cheryl,
Yes.
Karen,
No.
They're staying. I
okay,
say yes.
Leah, and I'm yes. Thank you everyone for attending and have a great night.
Thank you.
Thank you.